Good morning, everyone. Hello, my name is Councillor Kristen Wong-Tam. The clerk has confirmed that we have quorum. I'd like to call meeting 14 of the Toronto Accessibility Advisory Committee to order. Welcome, one and all. This meeting is being held using the city's WebEx technology with members and staff connecting by video conference or calling in. We ask for your patience with any delays and technical issues. Members of the public can observe the meeting on YouTube. We are also providing captioning for this meeting. A few reminders, please. Staff, please keep video turned off until you need to speak or answer questions. It makes it easier for myself as chair and those watching on YouTube to observe members as they participate in the debate for each item and during votes. Members and staff, please keep your microphones on mute unless you need to answer a question or to speak. Members, if you wish to speak on an item, and if you have your video on and you are able to, raise your hand or unmute your microphone and let me know, and I will create a speakers list. When voting, if you can, have your video on, and if you're able to, raise your hand or unmute your microphone to indicate your vote. For all those who are in the meeting room with us, the virtual meeting room, please ensure that your microphone stays on mute until it's time for me to acknowledge you, as there are a number of deputants registered to speak on this item. And members, if you have any motions, you must submit them in writing to the clerk. The clerk staff are available by email at taac@toronto.ca. Although we are in different locations and meeting remotely today, the committee would like to acknowledge that the land we're meeting on is the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people. And Toronto is still now home to many diverse First Nations, Inuit, Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. I want to thank everyone for their patience this morning as we are preparing for this meeting. I recognize that there were a few more glitches than usual, but I'm hoping that we have a smooth meeting as it is now, as it appears to have been sorted out. Before we begin the formal proceedings of the meeting, I do have some unfortunate and sad news to share with each of you. As some of you may know, we've recently heard and learned about the passing of Bill Alexander. Bill passed on January the 25th, just about a month ago. He has made tremendous contributions toward increasing access and reducing barriers for people with disabilities through his tireless advocacy, policy work, and development. He was also a part of countless stakeholder meetings which affected the master planning projects within the City of Toronto. Although I did not have the personal privilege and pleasure of knowing Bill Alexander, the legacy that he has left in the city is quite tremendous. Last City Council meeting, there was a motion of condolence passed in his honor. He was the first chair of the Barrier-Free Access Committee with the former City of Etobicoke, and after amalgamation, he sat on the first Toronto Accessibility Committee and chaired Parks, Forestry and Recreation's Community Disability Steering Committee. Bill's volunteer work, both at the Trillium Hospital and the Dorothy Lake Hospice, was quite important and valued. He was always informing the world of others and always trying to improve the world for everyone around. That is one of the reasons why he received the Community Action Award presented by Lieutenant Governor David Onley. I know that members of this committee, especially for those who know him, know Bill, know of his legacy, I share with you in this sadness and sorrow. And if we can, just take a moment of silence to reflect on this extraordinary life of Bill Alexander and all his many contributions to our community. Thank you, folks. Today's meeting is a special meeting. Obviously, we have there is one particular item on the agenda, and there can be no other items that are to be added onto this particular meeting. I'd like to begin by calling for any declarations of interest under the Municipal Conflict of Interest Act. And if you have an interest, please unmute your microphone or raise your hand to let me know. Seeing none, thank you very much. So let's proceed with the agenda. It is a special meeting, as I noted, and there's only one item, and no new business can be added. Today's meeting is going to be all about electric scooters, DI 14.1, electric kick scooters, also known as e-scooters. This item is coming back to us from City Council, and they're seeking our advice. The request is to have a staff presentation, and today we have Janet Lowe, Senior Project Manager, Strategic Policy Innovation, Transportation Services, to give us a presentation on electric kick scooters, also known as e-scooters. We also have a number of speakers on this item. I'd like to ask Janet to provide a presentation, and afterwards we will hear from our speakers, and we will go then back to questions of staff. I want to welcome Janet onto the screen and to ensure that she has access to present her video slides to us.
Thank you very much, Councillor Wong, Chair. I'm just sharing my PowerPoint right now and hope that all of you can see the screen. I want to thank everyone for your great patience and your interest in this issue. The last time I presented at this committee was a year ago in person, pre-COVID. The purpose of the presentation, there are 4 key goals. On this next slide, they're outlined. The first is to update the committee members on the status of provincial and city regulations on e-scooters. Next, I'll summarize how the accessibility and insurance issues proposals, how they might address these issues. The third is to share what's been heard from key accessibility stakeholders in response to some of the proposed solutions. And then finally, to consult the Toronto Accessibility Advisory Committee for feedback. Just to confirm, as was mentioned, the e-scooter that we're speaking about today is a 2-wheeled device where the rider stands on a narrow board like a large skateboard, but it has a handle stick that's used for steering. They're battery powered and they use a throttle to operate it. They can travel at a speed of 24 kilometers per hour. Some of the devices can be purchased online that travel at higher speeds. A number of jurisdictions have allowed rental or shared e-scooter fleets that can be rented on a per-minute basis or even on a monthly subscription basis using mobile apps. These devices are promoted as a first and last mile option to get to and from transit instead of using a car or ride hail or taxi. The slide here shows a photograph of e-scooter parking. It shows a painted white box on the sidewalk at the curb edge of a street with a symbol of a P for parking with about 8 e-scooters parked. This next slide summarizes the status of Ontario Regulation 389-19 that is for pilot projects for electric kick scooters. It's in effect from January 1st, 2020 to November 24th, 2024. It sets a 5-year pilot period where municipalities can opt in if they choose to test e-scooters. E-scooters use is not allowed unless a municipality permits it by bylaw, specifying where they're allowed to be operated and parked, such as on municipal public roads, bike lanes, cycle tracks, trails, paths, parks, sidewalks, or walkways. The regulation does state that if a municipality allows its use, e-scooters must use bike lanes where they exist, except for in a tunnel or underpass. Then e-scooters can operate on a sidewalk. They're not to be operated on control access highways or highways where pedestrians and bicyclists are prohibited. There are other requirements for the device, as I mentioned, such as the maximum speed, which is 24 kilometers per hour, and a minimum age of 16 to operate. In terms of the status in Toronto, under the city's bylaws, e-scooters are not permitted for operation currently on public roads bike lanes, cycle tracks, trails or paths, parks or sidewalks or walkways or public squares. The decision history has included that in 2019, in October, City Council prohibited the use of and parking or storing or leaving e-scooters on any street, sidewalk, or pedestrian way. This was to proactively prevent street litter and trip hazards. Last year, as mentioned, when I presented in person, in 2020, February 3rd, the Toronto Accessibility Advisory Committee recommended that City Council prohibit e-scooters for use in public spaces, including sidewalks and roads, and also requested robust consultation with people living with disabilities and related organizations. Finally, last year in July, City Council did not adopt the pilot and referred the e-scooter report, item IE 14.10, back to staff to research further changes necessary to address accessibility and insurance issues. No timeline was specified in the July motion. However, work has been ongoing, including meetings with stakeholders and tracking best practices. So now on this next slide, I'm going to summarize the key concerns that have been heard and that have been communicated to industry to get their feedback. Industries such as the e-scooter rental companies provided feedback in the fall and winter of 2020 and at a January 20 meeting just recently this year. We had 29 participants from 15 e-scooter rental companies to feed into this material. The key issues are e-scooter riding conflicts with persons with disabilities on sidewalks, especially for people who are blind or living with low vision, as well as older adults or those using mobility assistive devices. The next issue is the challenges with enforcement issues, especially for illegal sidewalk riding or enforcing the difficulties of enforcing moving violations. Next is the accountability for potential hit and runs on sidewalks and how someone injured by an e-scooter rider or a trip hazard would be compensated for the costs incurred, like rehabilitation, lost wages, or medical costs not covered by OHIP. This next slide is just a subheading where I'll move into the solutions for the two key accessibility issues regarding sidewalk riding and parking. So the first one is the potential solutions to address e-scooter sidewalk riding. The reason why there's a need for a combination of potential solutions is that it's not enough to have clear, consistent rules. In other jurisdictions, that hasn't been enough. The most important solution, which is the one listed first on the slide, as mentioned, most importantly, is having a protected bike lane network. So a continuous separated micromobility network that encourages people not to ride micromobility devices on the sidewalks. Industry feedback from this January also noted that a best practice is to place e-scooter parking on street so that trips begin and end off the sidewalk. Some of the other strategies are having field staff, ambassadors that educate people, having company patrol teams, and then there's as well city enforcement teams that are proposed, that are required in other jurisdictions. More and more jurisdictions are requiring visible, unique, identifiable plate numbers. These are license plates for rental fleets. This is done in a number of places like Calgary in Canada and Tel Aviv, for example. More jurisdictions are looking into the emerging technology of e-scooter sidewalk riding detection. This is an emerging technology. There's been recent announcements in the news. The technology can differ. It could be an onboard diagnostic that tells there's a different vibration pattern from sidewalk riding versus riding in the roadway. Sometimes the technology is based on camera feeds. These are not widespread yet and are being tested only in a few places at this time. And they are being tested for rental fleets and not private or personally owned e-scooters. This next slide speaks to a number of other proposals regarding e-scooter sidewalk riding. The first one listed is geofencing, pedestrian areas or slow areas. This is a method where there's a digital fence created for an area to either keep e-scooters away from that pedestrian area or to slow down e-scooters in that area. From what we've heard, though, there has been mixed feedback about the effectiveness of geofencing and differing opinions on the different types of geofencing. Some geofencing uses GPS, which is global positioning satellite signals, that are affected in part by building heights. Other methods use camera technology, as I mentioned, that suggests it may have greater accuracy. I would say that there's a not consistent opinion among both industry and jurisdictions regarding the effectiveness of geofencing, but improvements to geofencing appear to be ongoing. Some of the other strategies are education and warnings that the companies make to riders, and then there's also police enforcement and fines for riders. The challenge with police enforcement is that it does require, it does require police to be present. The next one is regarding suspensions and bans. If a behavior is repeated and traced back to a particular rider, there may be suspensions or bans by the e-scooter company for repeat offenders. I will say that early on in some of the pilots, we've heard from some jurisdictions that there was reluctance from companies to ban riders and to instead focus on education. However, more recently, it sounds like there's messaging from e-scooter companies to use this as a deterrent to achieve better behavior from riders. Some industry stakeholders have suggested installing decals on sidewalks or signage. This is like a painted mark on the sidewalk to say no e-scooters or yes e-scooters on where they're allowed or not. City staff have communicated that we believe this would contribute to visual clutter and potentially be confusing for places with or without decals and signage and the rules about sidewalk riding. We do have many kilometers of sidewalks and paths. This would require quite a number of these and the maintenance of them. Finally, it's been suggested that audible warnings or an audible sound be added to the e-scooter devices when they're operating to alert pedestrians. We're not hugely in favor of this. We've heard some feedback that it may be desirable. However, we don't believe that it will be clear exactly where the sound is being emitted from so that someone knows exactly where it's coming from and that there's a potential noise nuisance as well. So those were regarding e-scooter sidewalk riding. The next big issue has been about improper e-scooter parking. And so here are some of the key potential solutions. The first, again, is having an adequate supply of designated parking areas, because if they're more frequently found, riders are less likely to leave an e-scooter in the wrong place. In recent feedback from industry stakeholders, they also recommended that having fleet size caps that start out modestly and are reviewed and adapted frequently can be a tool to manage compliance issues. The next one is regarding technologies for proper parking verification. So selfies can be used to confirm that a rider has parked the e-scooter properly, and other camera technologies. The next one is having, again, field staff, the patrol teams from companies to remedy issues and complaints. The minimum service standards have been typically 1 to 2 hours, or sometimes better, especially during pilot projects. The next one is regarding adding Braille and tactile identifiers for reporting issues or complaints with an e-scooter that's creating an obstruction. This is in addition to the license plates for the rental fleet. Finally, more recently, it's gaining attention in the news, for example, in Paris, that a definitive way to have devices docked or locked in locations so they're not creating obstructions is having docked stations like Bike Share, Toronto's fleet. I will mention that mostly we've been hearing from industry that they do prefer either a hybrid model or a dockless model. This next slide speaks to a few other proposals for addressing improper e-scooter parking. Sort of a widespread method, of course, is education and incentives, such as discounts for proper parking or penalties for improper parking or repeat offenders. Another method some jurisdictions do is they fine the company directly but there has been discussion among jurisdictions about whether this is getting passed on to the riders to change their behavior or whether the company absorbs it. Finally, there's a few other ones. Lock 2 is a mechanism that is like a bike lock or cable that is attached to the stem of the e-scooter. The Lock 2 proposes to use, bike posts and rings, such as how bicycles are locked. E-scooter rental companies propose that bicycles are allowed to be locked this way, so e-scooters should be treated the same. Another one is having a double kickstand so that e-scooters are less likely to topple over, and onboard diagnostics indicating whether the e-scooter has toppled over. There are two photographs on this slide. One shows an e-scooter being locked to with a cable to a railing at step to an entrance by a man wearing a bicycle helmet in business casual work clothes. The next photograph is of an e-scooter locked to bicycle parking. The bicycle parking is in the shape of a metal loop attached to the sidewalk in San Francisco with a bike lane painted green in the background of the photo. Sorry, I did move through that fairly quickly, but I'm happy to go over any of those later on when there's questions. This title slide speaks to insurance and liability issues, where I'll discuss the key solutions. From discussions with my city's corporate colleagues in insurance and risk management, what the city requires is first and third party insurance coverage. This is done in the trials in the United Kingdom, as well as Germany, Malta, for example. What it means is that there would be compensation through the insurance coverage. For example, when an e-scooter rider hits and injures a pedestrian, that pedestrian is the third party, or an e-scooter is left as a hazard and injures a pedestrian, again, the pedestrian is the third party. There are some other proposals that industry suggested that are not included on this slide because it did not satisfy the concerns from insurance and risk management. These were to potentially increase the commercial general liability coverage, which is the coverage that an e-scooter business has for itself, but it's not seen as enough coverage. Another one that was suggested was creating some sort of safety or compensation fund or infrastructure fund that's financed through some sort of fee system. That would require further investigation and engagement of stakeholders like the insurance company, the province, micromobility operators, and others. We also don't believe that simply putting a fee on micromobility trips would be enough to finance infrastructure needed, as well as this safety fund as suggested. So that would require further work to look into. But for now, what the city, from a city insurance and liability perspective, we would require first and third party insurance as is asked for elsewhere. This next slide speaks to just a couple examples of safety issues. These are beyond the ones raised from last year in the city staff report. More recently, from Germany and Austria, according to the UDV, which is the German Insurers Accident Research Group, in an article in January 2021, e-scooter riders are 4 times more or 400% more likely than cyclists to injure others due to e-scooters being illegally ridden on sidewalks. In one of their studies, 21%, in the study that's based on federal statistics collected by police between January and September 2020, there were 1,570 incidents with e-scooters in which people were injured or killed. In 21% of those e-scooter incidents with personal injury, the victim was not the rider, but another road user. The German Insurers Accident Research Group says that this is in due part to e-scooters being ridden on sidewalks 60% of the time in their study when they should be on the road or bike lane. So there's a German national law that e-scooters are not to be ridden on sidewalks. In Austria, the KFV in October 2020, in an article, showed that 34% of 573 e-scooter riders observed in Vienna at different locations were illegally riding on the sidewalk. Even where there was a bike path, 23%, or roughly 1 out of 5, prefer the sidewalk. If there was only one cycle or multi-use purpose lane, 46%, or almost half, rode on the sidewalk. And again, if there was no cycling infrastructure, half of people using e-scooters were illegally on the sidewalk. This next slide moves on to the section where I summarize feedback from accessibility stakeholders that we've heard from. This is not a comprehensive list. In order to fit this in, we met with industry in January, and we shared the solutions that industry provided to us with some of the key accessibility organizations. We had telemeetings with B'nai B'rith Canada, League of Human Rights, the Canadian National Institute for the Blind, the March of Dimes. We've also received numerous written submissions, including letters to the mayor from the organizations that I just mentioned, as well as the Canadian Council of the Blind, the AODA Alliance, so I was requested by TAC to share the written submissions, which are in a supplementary attachment to this presentation that shows the letters. Some of the other organizations that were part of the open letter to Mayor Tory, as well as to Premier Ford and other Ontario municipalities, include as well ARCH, the Disability Law Centre, Spinal Cord Injury Ontario, Ontario Autism Coalition, the Older Women's Network, the Alliance for Equality of Blind Canadians, Guide Dog Users of Canada, Views for the Visually Impaired, and Citizens with Disabilities Ontario. So I've tried to create some themes for the feedback that we've received. One of the first themes is that technologies are still emerging and not adequate yet. Speaking to the geofencing and other technologies, such as sidewalk riding detection, they're not sophisticated enough and would only apply to rental e-scooters and not personally owned or privately owned e-scooters. There is some interest in the docking stations for e-scooters and that this has potential, but it is still in development, and stakeholders would like to see it being used in other jurisdictions and more widespread to see how well it's working. There are concerns about the lock-to cables on e-scooters, as they could be locked anywhere, as like cafe fencing or railings, and in spots potentially blocking entrance, access, and paths of travel. Already there's a lack of bike parking, and so this would worsen the number of sidewalk obstructions on already narrow and cluttered sidewalks. Bikeshare Toronto's fleet is over 6,800 bikes currently. If they were dockless, there wouldn't be enough bike rings to lock those thousands of bikeshare bikes, and the same for the dockless rental e-scooter fleet, given the volume. On this next slide, the theme regarding feedback is that there are not enough city resources for enforcement and for infrastructure priorities. The oversight of e-scooter programs is very labor-intensive and resource-intensive, and feedback has been that enforcement is already stretched or non-existent in parts of the city. While license plates on rental e-scooters could help, this is seen as a reactive tool and would be a drain on city resources to monitor and enforce. The bigger priorities we've heard for limited city resources. Inadequate infrastructure is a bigger priority. Not enough sidewalk space or accessible infrastructure, not enough bike lanes or bike lane space, and not enough public transit. Finally, the importance of other city priorities before allowing something that is seen as a potential hazard and a nuisance for pedestrians and persons with disabilities is something we've heard. And this last slide is just reiterating the concerns that the impacts on seniors and persons with disabilities is especially difficult. With COVID-19, it's resulted in many challenges for persons with disabilities, their caregivers, and pedestrians who use sidewalks as a necessity and not for recreation. That allowing e-scooters would pose hazards and risk severe injury for seniors or persons with disabilities if tripping and falling or struck or in a conflict with an e-scooter rider. And then the inability to identify e-scooter riders given their speed, and that the person's credit card on the app may not necessarily be the person riding on the e-scooter. Again, I'm happy to go over any of that if I know I'm moving fairly quickly. I want to make sure that there's time for speakers and questions. This next section is about the Canadian context and other jurisdictions. In terms of other major cities in Canada, Montreal will not have rental or shared e-scooters in 2021. They're focusing on bike share and e-bike share. Vancouver currently does not have rental or shared e-scooters and also has a large bike share system. The city of Hamilton and Mississauga, and the city of Mississauga will now allow privately owned or personal use e-scooters. They are working on potential shared micromobility programs that are pending for e-scooter share and bike share. York Region allows e-scooters now on bike lanes on regional roads. We understand there's some issues that are being discussed between local municipalities and the region, such as regarding responsibility and roles and liability. A few other jurisdictions in Ontario are in the process of consultation, public consultation and review. That includes London, Waterloo Region, and Windsor, and things have been a bit slowed with COVID-19. I'll speak to two other Canadian cities that have piloted e-scooters. The first one is the city of Calgary. One thing that's important to keep in mind as I speak about both of these is the differences in context among cities. Each city is quite different. For instance, Toronto's downtown is 12 times the population as Calgary's downtown using the last census, and our pedestrian mode share in Toronto for walking trips is significantly higher. In Calgary, there is no bike share system. Also in Alberta, only rental e-scooters are allowed, not privately owned or personal use. Calgary allows e-scooter riding on sidewalks. They were not allowed to be on the roadway in bike lanes, for example. 43% of 311 requests about bad behavior or conflicts with pedestrians were noted in the staff report in Calgary. 42% were about parking concerns. They had a total of 769 311 requests regarding e-scooters over their total pilot period. Council has now decided in Calgary that they are going to allow e-scooter use on some roads to reduce sidewalk riding issues. Calgary did add in their second pilot some slow speed zones, and they also added 30 parking zones. There was some limited piloting of the parking zones. 2.5% of riders ended trips in parking zones, and 10% of the e-scooter fleet was deployed to the parking zones. The e-scooters are to return this year via a procurement process. Calgary is lowering the fleet cap from the 2,800 in 2020 back to the 1,500 in 2021. Calgary will be requiring license plates for enforcement. Calgary staff said to their council that it is likely that e-scooters have the highest rate of injury per transportation mode, but that this is less severe than some of the incidents for cyclists and drivers, which included intensive care or facilities. Again, it's important to note that e-scooters were allowed to operate on sidewalks, which is not the case for cyclists and drivers being allowed to be on the sidewalks. Calgary staff noted in their analysis they did not factor in the rate of travel by mode. There are more bicycle trips and driving trips than e-scooter trips, and there is no analysis on a per kilometer basis. In Calgary's chart in their report, it showed that 43% of the e-scooter injuries that were transported by ambulance required surgery. That is double the number they show for the bicyclist, which was only at 21%. In Calgary's staff report, 37% of severe e-scooter injuries had suspected intoxication. In total, through their hospital study, there were 1,300 e-scooter-related ER visits during the total of the pilot period. They noted this may be over-inclusive of other devices referred to as scooters, such as mobility-assisted devices. 75 were focused in on that required ambulance transport. 5% of those were pedestrians injured. I will note, again, with context, in a more pedestrianized city like Copenhagen, a similar hospital study showed the pedestrian and non-rider injuries due to e-scooter incidents was 14%, so higher. The next example is City of Ottawa. Similarly, City of Ottawa to Calgary has no bike share. They do allow personal use and personal use of privately owned e-scooters as well as rental e-scooters. These scooters are allowed on roads with a maximum 50 km per hour speed limit. They're allowed in bike lanes, and they're allowed in trails and paths, but not where there are the National Capital Commission multi-use paths, as there was concern about conflicts with pedestrians on those, which does make up a good part of their multi-use path network. Ottawa lowered the maximum speed to 20 kilometers per hour for e-scooters from Ontario's permitted 24 kilometers per hour. They had some slow zones, such as near transit malls and stations, that were around like 8 kilometers per hour, that used the geofencing to slow e-scooters down. They piloted a fleet of 600 e-scooters with 3 vendors in 2020. They will increase the fleet cap to a range between 1,200 to 1,500 and are expanding outside the Greenbelt to suburban areas. In their online survey, 76% surveyed used e-scooters for recreation, 2% to connect to transit. It's important to point out this is under a COVID-19 context. They will pilot in 2021 via procurement process. In their cost recovery, staff labor costs were not included. They are considering having designated parking areas. 69% of all survey respondents reported encountering misparked e-scooters. Ottawa City staff noted they did not conduct an injury data collection with hospitals, and it's not likely that they will do any injury data collection in 2021, given the pandemic and the busyness of hospitals. Accessibility stakeholders were consulted and have raised concerns about sidewalk riding and parking issues, as well as barriers for persons with low vision or no vision. This next slide looks at large urban peer cities. As mentioned, the City of Toronto likes to look at cities that have similar large populations, similar urban form and density, and similar climate. In downtown Chicago and New York City, rental e-scooters are banned. There are no rental or shared e-scooters in places yet, such as Montreal or Vancouver, Massachusetts, such as the City of Boston, Pennsylvania, such as the City of Philadelphia, New South Wales, such as the City of Sydney. In Melbourne, there's a regional rule that e-scooters have to have a maximum power of 200 watts, which does make it very challenging because most e-scooters have require higher watts than that. In Scotland, there are no e-scooters, such as the City of Edinburgh. Same with the Netherlands, such as the City of Amsterdam. Other cities that have banned or since banned them include Copenhagen in the city center, Houston, San Diego for their boardwalk ban. Given mixed-use paths, they found that there were too many conflicts with the mix of users. So in New York City, outside of Manhattan only, and for transport for London in the UK, pilots are still not yet underway, though there is planning in the works, and we would look at those with great interest. So I've gone through quite a lot of information. This next section is posing what the questions are that we have for the Toronto Accessibility Advisory Committee as directed by Council to consult accessibility stakeholders. The first one is whether there are questions or comments regarding the proposed solutions and proposals, and I'll bring back these questions for reference. one is whether there are any questions or clarifications regarding the feedback that we heard from accessibility stakeholders. The next one also is about whether this information was adequate to help provide information to satisfy whether there are continued concerns from what was raised before. Does any of the information provide new questions or any new issues or concerns that you'd like to point out to us? In terms of process, as directed by City Council, Transportation Services staff will take into consideration the feedback from accessibility stakeholders and the TAC, as well as the research we've conducted, into a report back to the Infrastructure and Environment Committee and then to City Council. In terms of timelines, it is most likely April 28th, which is the next Infrastructure and Environment Committee meeting. We don't think we can turn something around given the amount of interest at today's meeting for March. My contact is on this slide. People have been able to email me at janet.lowe@toronto.ca and also to contact me by phone if they're not able to email me at 416-397-4853. The reports, as you're aware, are posted 5 business days before the committee meeting, and that would be for the next Infrastructure and Environment Committee meeting. I apologize for speaking so quickly. I am interested in hearing what the committee members have in terms of questions and feedback, and I'm happy to go back and speak to any parts of my presentation that I should clarify. And I want to thank you for all of your time today. I know it's difficult during these times, and we really appreciate you taking the time and having patience with us. So that is my presentation.
Janet, thank you very much for your presentation. I think it was very full and extremely informative. At this point in time, we're going to move on to speakers from the public who have registered. I know that they want to be heard by the committee members. And before I call our first speaker, I recognize that Councillor Fletcher has joined us today. So welcome, Councillor Fletcher. At any time, if you'd like to ask questions.
Good morning, everybody.
Hi, good morning.
Thank you, Chair.
And just Councillor Fletcher, just wanted to let you know that if there's any, at any time if you'd like to speak or perhaps ask questions to either city staff or the public members, please let me know and I will acknowledge you.
Appreciate that. Thank you.
Thank you so much. So, folks, for our speakers who have been patiently waiting to be heard, now is your time. Each of you will have 5 minutes to speak. If I can just ask those who are not speaking to remain on mute so that we can hear the actual speaker who has the floor. And for everyone who is registered to speak, if I can ask you to keep your video off unless you want to have it on, and even then it's for the to make the accommodations just because we're struggling with our bandwidth here. So our first speaker I'm just going to recognize is John Ray. Following John is Edward Rice and then John Mosa. So if you folks can get ready to speak. John, are you there?
I am, Madam Chair. Can you hear me?
Yes, I can, John. And I will have a clock for you. It's 5 minutes. I know you may not be able to see it, but at the 30-second, 15-second mark, I'll let you know that you're running out of time, okay?
Thank you very much. That would be most helpful.
Okay, you have the floor, John. Go ahead.
Before I begin, Madam Chair, I have to apologize. I'm in a rather noisy environment, and I unfortunately, this is beyond my control. So I hope it won't be too distracting. Now, on to my presentation. Madam Chair, members of the committee, thank you for the opportunity to appear. I appear on behalf of the Alliance for Equality of Blind Canadians, a national organization of Canadians who are blind, deafblind, and partially sighted. We have a very active chapter here in Toronto that has been very active on a number of municipal issues. I want to begin by expressing my deep appreciation to this committee for the leadership it has taken on opposing e-scooters and for the time that you have invested in scheduling this special meeting. That's much appreciated. Ladies and gentlemen, we are gathered here this morning to discuss what is called the e-scooter. I actually believe this issue should more appropriately have been titled the e-menace, because that's exactly what e-scooters are. They're a menace. They're a menace to pedestrians, and they should never be allowed on Toronto streets, not for testing, not permanently, not ever. The ban should be continued now and forever. I am a native Torontonian. I am totally blind, and I'm also now a senior. All Ontarians, all municipalities live under the AODA. That act was designed and intended to require the removal of existing barriers and the prevention of new ones. I submit that any testing or allowing e-scooters on our streets would be an egregious new barrier, a new menace that we don't need. As a long-time, as a native Torontonian, I have to say with great sadness that I find our city is becoming less accessible. Yes, you heard me right, less accessible to me as a blind person. Consider the amount of sidewalk clutter that we all have to contend with. The cement that surrounds some trees or flower beds. The number of construction sites that can vary day to day. And I submit our TTC as well, now that there no longer are fare collectors in booths that have been typically easy for a blind person like me to find. The introduction of e-scooters would simply exacerbate getting around our city. This is an issue of pedestrian safety. And as I look at our city, Madam Chair, it seems to me that it's a situation where what business wants, business almost always gets. That may sound cynical and it may sound a bit strong, but look at what City Council does. It approves most requests for business. I think this is one time when a different approach should be taken. That pedestrian safety, I think that's rather important. It should trump what business wants. Oh my God, did I really use that word? Oh my God. So what we need is a continued ban. Let's be very clear about that. These new menaces are too quiet for me to hear their approach. While they are expected and required to remain on the roadways, you know as well as I do, they will inevitably meander off the street and onto the sidewalk. And then where will they be parked? That's more sidewalk clutter that we don't need. So, Madam Chair, I think the case against e-scooters is strong. And I think that this is an issue of pedestrian safety that has disproportionately impact on the disabled and elderly communities. And for a city that wants to become more walkable, that wants to become more accessible, the ban on e-scooters, the e-menace as I call it, absolutely must continue. And I'm hoping that this committee will follow that recommendation in the strongest possible terms.
Thank you.
Back to the Infrastructure Committee and eventually back to Council. Oppose e-scooters on our streets. Thank you.
Thank you, John. Thank you very much for your deputation. Are there any members from the committee, including our visiting councillor, who have any questions of the first speaker? If I can just get the screen. Because I can't see everybody, if you do have questions, just please feel free to unmute yourself and I will recognize you. And seeing and hearing no one, I will move on to our next speaker. Okay, thank you.
Thank you, ma'am.
Okay, thanks, John. Nice to hear from you. Our next
Thank you.
Thank you. Our next speaker is Edward Rice, Canadians with Disabilities of Benign Birth Canada. Welcome, Edward. You have 5 minutes, and I'll start your clock when you're ready.
Thank you, Madam Speaker. First, I'd like to thank the Toronto Accessibility Advisory Committee members and the Standing Committee members for this opportunity. I'd like also to thank Janet Lowe for an excellent presentation that she gave. She covered a few areas that I was going to cover, so I won't go over them again. But just to reiterate, for Canadian perspective, the city of Calgary in 2019, due to a CBC News report, had for the summer had about 120 incidences of emergency room visits due to e-scooters. And in 2020, it escalated up to 1,300 as compared to only 2,000 bicycle incidences. So let's extrapolate that with the population of the city of Toronto. You can imagine those numbers would skyrocket considerably, overcrowding our emergency systems as they are. So injuries to the rider and pedestrians, people with disabilities, will just be increased to an exponential amount. The aspect that she was covering, I know that could protect the city, protect the companies from being sued, but it still does not protect anyone, city or the companies, from an individual launching a lawsuit, which would involve city staff encountering paperwork regarding insurance claims that may or may not win, but will also encompass taking up city employees' times, which ultimately costs the taxpayer money. Also, I have submitted, which I hope the council, the committee members have received, 2 photo pages of documentations. And I was wondering, does everybody have that?
Yes, we all have that.
Okay. The first page, which is marked 102, is when I was in Fort Lauderdale on vacation last February. And these pictures are taken within a 2-block area. There's 8 photos here. And in the 8 photos, there's a total of 25 e-scooters literally littering the sidewalks. I personally have a disability. I have polio. I'm dealing with post-polio syndrome, which necessitates me to use a 3-wheeled motorized scooter for mobility. The e-scooters can go up to 20 kilometers an hour. With my mobility scooter, 5 kilometers an hour. So as you can see, I would lose a race with them. But last year when we were there, it was a most embarrassing and personally humiliating circumstance for me to ask passersby, good Samaritans, to please remove the scooters from the path of the sidewalk where I was traveling on. And this was done 2 to 3 times per block. So it is a case of these scooters, and the riders who use them really don't consider anybody else. They just leave them haphazardly lying around anywhere that they can throw them, which causes a problem. And if you're sight impaired, it's even more dangerous because they're small and they're not very high. And when they're kicked over, you'll trip over them, no problem, and you'll cause yourself an injury. And then where do you go from there? I saw a policeman there. I asked him about the situation. He said there's nothing they can do. These riders zip along. They can either bump into somebody, knock somebody over, and they keep going. And there's no way of finding out who they are, no way of arresting them, no way of prosecuting them. There's no recourse left, just injury to the innocent person who was bumped into by the rider of the scooter. So as you can see, that alone is a reason for not allowing these scooters on our streets. We have enough problems in Toronto. The third page that I gave here is that Shell Oil Company has now gotten into the scooter business, as you can see, and they had a slick YouTube presentation done. And you can see from picture number A, a scooter rider on a path. But you'll notice
15
it's not
seconds.
realistic because they're the only ones on the path. There's no other people around. In the city of Toronto, that's not going to happen on any street you go to. And on the bottom picture, he's using a helmet. Our helmet is going to be required. Who's going to supply the helmets? The
Edward,
city, the vendor?
Edward, sorry to interrupt. Your time is up. If I can get a final thought from you.
The final thought is that it's up to City Council and the mayor to provide a safe city for us. And this is a major factor in keeping Toronto safe. So let's keep Toronto safe. Thank you.
Thank you so much, Edward. Thank you for your deputation. Are there any members from the committee or visiting councillor who would like to ask questions of the speaker? Okay. Seeing none, Edward, thank you for your deputation. Our next speaker is John Mosa, followed by Melanie Marsden, and then Andrea Hatala. John, are you here?
Yes. Before we start, we are sharing this deputation together with Melanie Marsden and Andrea Hatala, and I asked them if they could be unmuted and see if they are. Andrea, are you unmuted?
Yes, I'm unmuted.
Yeah.
Melanie?
Can you hear me okay?
Yes, we can hear all three of you. John, are you
Great.
asking for, sorry, it's the chair speaking, just to clarify so I know how to manage the time. John, Melanie, and Andrea, are you asking for a combined 15 minutes?
No. We'll hopefully do it in 5 minutes.
Oh, okay. Well, you're very efficient then. Thank you very much. Proceed when you're ready. And I'll start your clock.
Okay. Hello, my name is John Mosa. I'm here with Melanie Marsden Myers and Andrea Hatala on behalf of the Greater Toronto GTA Disability Coalition. And we thank you for the opportunity to speak today. We are a network of cross-disability, nonpartisan community organizations and people with disabilities, and apply a nothing about us without us disability lens to our engagement with all levels of government and other sectors. We're here to speak about the urgent need to ban the dangerous stand-up e-scooters in Toronto. We have identified 3 areas of concerns regarding e-scooters. First, e-scooters are a risk of serious personal injury. As a person who uses a power wheelchair, I do not want to be exposed to the serious dangers and personal injuries that e-scooters would cause in Toronto. For example, as mentioned in the presentation by Janet Lowe and Eddie Rice, in Calgary, Dr. Eddie Lang studied and saw that almost 700 emergency room and urgent care visits of adults and children happened because of e-scooter related injuries last year. We do not need to have this increase in hospitalization, especially during COVID-19. People with disabilities have already been discriminated and deprioritized from healthcare, especially with the provincial triage protocol, which rations ICU beds under an ableist fragility test. And I'm going to pass it on to Moni to talk about issue number 2.
Issue 2, e-scooters will create 2 major accessibility barriers. First, they are silent and go at high speeds. People with disabilities, especially with visual disabilities, won't hear or see these silent e-scooters. The silent e-scooters will fly by us and there will be no chance to avoiding being hit and injured. As well, we will not be able to identify e-scooter riders who will have probably left the accident. Secondly, e-scooters in other cities have been left on sidewalks and curbs, causing access barriers and dangerous tripping hazards. People with disabilities, seniors that use wheelchairs, walkers, canes, and have balancing issues are already facing physical barriers like snow and broken sidewalks. Why make us even more vulnerable to e-scooters? Toronto must make decisions to be a barrier-free city, not an e-scooter dangerous business adventure, where the outcome will be more hospitalization from being hit, keeping in mind our hospitals are already stretched thin. Our focus must be a just COVID recovery. To you, Andrea.
Okay, so I think that you should, I think that it's crazy to allow e-scooters. First of all, they're unregulated and there's no legal enforcement as of yet. So there's too many personal injuries because they would whiz by people that were walking on the sidewalk, and they would whiz by, like, you know, not only people with disabilities, but children use the sidewalk, seniors use the sidewalk, people use the sidewalk for walking. And they go from 3 to 5 kilometers an hour, and these e-scooters go at 20 kilometers an hour. They're silent, and people don't see them creep or hear them creeping up. There will be more injuries, and the people that will pay for these injuries is the city of Toronto when they get sued. They'll make more disabled people in the city. E-scooter lobbyists. Oh, and I don't think that you should listen to the e-scooter lobbyists and the corporate, their corporate songs and dances. And you should focus on a just COVID recovery. I'll pass it back to John.
Thank you. Your time
Thank you, Andrea.
your time is up, but if there is one final thought, we would like to hear it.
Yes, so in conclusion, the GTA Coalition agrees with the 808 Alliance and recommends the TAC take the following 3 immediate action. First, the use of e-scooters in any public place should remain banned in Toronto. There should be no pilot project as the second recommendation. And third, city law enforcement officers should now enforce the ban on anyone riding an e-scooter in Toronto. And we thank you for letting us speak today.
Thank you so much, John, Melanie, and Andrea, for your presentation. I would just take a look to see if we have any questions from our committee members. And I see that Wendy has her hand raised. Go ahead, Wendy. I acknowledge you.
Thank you, Councillor. I wanted to ask the speakers if they could elaborate a little bit. I think that they've made a very important point about our current context in terms of healthcare, access to healthcare for people with disabilities. So, you know, it was mentioned that we are, and we all know we're in the COVID pandemic, and we're all dealing with having to make choices around when we access healthcare services and under what circumstances. And I think that that's relevant here because I think that we need to think about this in the context in which we're in. And I just wondered if I could ask the speakers to maybe elaborate a little bit in terms of what their current experience is around trying to access healthcare. You know, considering that the outcome of any kind of a pilot could potentially be increased numbers of folks needing to seek healthcare services. So could I ask the speakers to just give us a little bit more information there?
Sure. My name is John Massa. If, for example, I were to go out and be hit or be hospitalized, it would have a devastating impact as it require on PSWs on a daily basis, and also my family. And with COVID restrictions, I would not be able to see my family or my PSWs, and it would be devastating for me. I find it just ridiculous that this would be even considered, even just with one injury. I mean, Calgary had 700 in the first year, and it sounds like they had 1,300 in the second year. It just doesn't make any sense. I'm not sure if Andrea or Melanie has others things to say.
Well, Sorry, I think just to follow up, it's around once you get injured and you're at the hospital, right? We know from the triage that we have no idea whether our lives will be valued in terms of what injuries took place, right? So if it's a head injury and you also have a disability on top of it, it just complicates it. So we need to be focusing on the just recovery for COVID, not creating more injuries. Thank you.
Thank you. Wendy, do you have a follow-up question?
I don't. Thank you.
Okay, thank you. Any other members who have questions for these speakers? Seeing none and hearing none. Thank you so much for your deputation. Our next speaker is David Lepofsky, followed by Jennifer Griffith and Colin Stark. David Lepofsky, are you here?
Can you hear me?
Okay, go ahead, David. You have the floor.
Can you hear me okay?
Yes, we can hear you, David.
Okay, great. Thank you very much. Credit and commendations both because this committee voted unanimously a year ago to advise the city not to allow e-scooters and that you are focusing on this today. What do we know? What is beyond dispute? I agree with everything on behalf of the Accessibility for Ontarians with Disabilities Act Alliance. I agree with everything that we've just heard the previous speakers say. What does it boil down to? Number one, there is overwhelming, unanimous opposition among disability community advocates and voices to allowing e-scooters either as a pilot or permanently in Toronto. And from the excellent presentation by city staff this morning, there is overwhelming proof, data, practical experience from those other communities which were foolish enough to allow them to show that the concerns we have are not hypothetical, they're not unfounded, they're absolutely real and they are serious. So in the face of this, why are we even talking about this, much less in the middle of a pandemic? That's not we're delighted your committee is raising this now because the city council has been focusing on it. Well, we now know why. And the AODA Alliance has been in the lead in proving why. There has been an unbelievable, well-funded, well-orchestrated, well-connected corporate lobbyist feeding frenzy at City Hall on behalf of the e-scooter rental companies. They are clearly reaching city councilors, they are reaching senior staff, they are reaching not senior staff. The only people they may have missed out on are a couple of janitors at City Hall to push their product. And their influence is so profound. We showed that in 2 years, there were over 1,300 contacts with the city by them, including 94 with the mayor's office. Fully 94 contacts of different sorts. And that's only as of last October. We don't know about the data since then. And what we know from this is that, what are the results? Well, we're still seeing the city looking at this despite the excellent staff information showing we don't need it. We know that the mayor, who was kind enough to speak to me over a year ago, has not even answered either of the 2 letters that we sent him on February 6th and October 4th of last year, nor has he taken up our request that he speak with us again. Moreover, we know last summer when City Council had this before them, and a motion was brought for the staff to look into your committee's concerns, for the staff to look into what the disability concerns are. Well, it's good the resolution passed, and here we are. But fully 11 of the 23 voting council members that day, 11 of the 23 voted against any investigation. They didn't want to hear the information that Ms. Lowe so excellently summarized. They didn't want to hear what more about the concerns this committee had. That is inexcusable. Moreover, what we now know is that the e-scooter companies don't have an answer to these concerns. The recommendations that they brought forward as solutions to these concerns, after having experience with e-scooters that they have been deploying in other cities, with their first-hand experience, their solutions don't solve the problems, but dump a lot of the costs on the city to implement those solutions. That's why we say their strategy is they want to be laughing all the way to the bank, while injured pedestrians, including people with disabilities, seniors, kids, and others, will be sobbing all the way to the emergency room. Moreover, their underlying claim of why we should do this, you heard the term micromobility. The idea is you'll take the subway to downtown and then you'll grab an e-scooter to get to your destination. Well, that only works if you want to go back to the subway, if there are e-scooters lying around everywhere, or if we've displaced scarce parking everywhere to have them docked and available so that people can know they're available. Well, unless they are saturating the downtown, that very theory underlying their whole case for why it would be great for Toronto just collapses. So what do you do? So we want to suggest two things to you. First, we proposed a 3-point motion we ask you to pass. No e-scooters permanently, no pilot with e-scooters that would experiment on innocent Torontonians just to prove what we already know, that they're dangerous and they injure people, and call on the police department and law enforcement officials to enforce the current ban on e-scooters for those who've bought them privately and are illegally riding them in our city now. But the other thing I want to suggest to you is this. I know that some members of accessibility advisory committees in some cities have incorrectly been told by some city staff in other cities that, oh, if you're on this committee, you can't do advocacy. Yes, you can. That's why you're here. So we urge you to not only pass a unanimous strong motion like we propose, but we ask you to go to members of City Council and call them to one of your meetings. Go to them individually, go to them collectively, especially the 11 that didn't want to hear what Ms. Lowe's report disclosed, and tell them that they've got to stand up for Torontonians, including people with disabilities, and they've got to stand up to the e-scooter corporate lobbyists. Thanks so very much for your dedicating your time and your effort to the cause on this issue and the other accessibility issues that your committee has been dealing with. I'm delighted to take questions if you like.
Thank you very much, David. And I lost track of your time, but you were at 6 minutes plus. But I think it was very important information to share. I want to just see if I can get everyone on the screen. Are there any members from the Standing Committee who have questions of the speaker? Yes, Miranda, I see and recognize your hand. Hi, Miranda, you have the floor. Go ahead.
Thank you so much. So first of all, thank you, Janet, for the wonderful presentation. I think it was very comprehensive in its information that it provided. And to Janet and all speakers, I'm just wondering if you can speak a little bit more about alternative solutions then. What do you expect in terms of some other options? Are there any suggestions and more reasonable ideas that you have for implementation instead of the e-scooters? Because I agree that we do have to focus on recovery, rebuilding from the pandemic, but at the same time, I also think transportation is still an issue within the pandemic, and sometimes even more so where there's lack of access to getting around and to accessing even groceries, for example, because of everything that's going on with the restrictions and lockdown. So I'm just wondering if the presenter and also the speakers can speak to that a little bit more in terms of what do they see as a more proper solution, some options and reasonable ideas.
Okay, Miranda, thank you. This is Councillor Wong-Tam speaking. Just for clarification, this question is going directly to our speaker, David Lepofsky. There will be an opportunity to ask questions of staff afterwards. So David, if you'd like to take an opportunity now to answer this question.
Sure. Thank you for the question. We'd be happy to address that more fully. We don't see e-scooters as a solution to those issues. You're not allowed to use it for shopping because you're not supposed to carry groceries while you're on it. That's supposed to be part of the thing. And we would say that the role that the e-scooter corporate lobbyists are pushing is amply covered by bike share, which commendably we now have. So that we have a way to get people transported. They don't create any pollution. They don't create the kind of problems that the e-scooter batteries would cover. They don't race at these excessive speeds. You can't throttle up in a second way up to a higher speed. So we're totally not against bikes at all. To the contrary, they're filling the need, and there is no proof that the incremental benefits supposedly of e-scooters over and above bike share it has any value at all. We just know it's going to cause a lot of damage. We're happy to explore other solutions later, but the first thing we got to do is make sure that things don't get worse by allowing e-scooters now.
Thank you.
Okay. Thank you very much, Miranda. Do you have any follow-up questions, or are there any other members or the visiting councillor who has questions? Okay. Seeing none, thank you very much. Thank you very much, David, for your deputation.
Thank you.
I would like to call upon Jennifer Griffiths, followed by Colin Stark, and then Chris Schaefer.
Sorry, Madam Chair.
Oh, I'm sorry.
I've had my hand raised, but I guess no one can see it. I'm not sure if I'm doing it correctly, but I just had a question for Mr. Lepofsky, if that's okay.
Yes, of course, Jason. I apologize. I did not see your hand, and I apologize. Go ahead. You have 5 minutes.
I probably wasn't doing it properly. Probably on me. So, David, I just have a question for you, given that how do you see the e-scooter pilot as conforming to or not conforming to the AODA? How, in your view, does it run afoul, if at all, of the AODA? Thank you.
All right, can you hear me now? Sorry, somebody unmuted me and WebEx is a bit troubling. Can you hear me now?
Yes, we can hear you, David. Go ahead.
Okay, great. So first, why would we do a pilot? In other words, from the perspective of those advocating for it, what's the purpose of a pilot? You need to know that to answer the excellent question. Those proposing it have never said what the purpose is. We don't need a pilot to know about the information that Ms. Lowe's excellent report documents. We've got ample proof of it. We don't need to find out that people with disabilities and others, seniors and kids, will get hurt here, because we know that they get hurt elsewhere, or that these constitute a barrier. So you do a pilot supposedly to find out something you don't know. We don't need to do a pilot for those things because we do know. We believe the corporate lobbyists want to do a pilot for the purpose of getting their foot in the door. They are marketing a product. That is their sole objective. And in doing that, they want to get things started so they can get more people using them. And then once they know from other cities, once they're in, the burden of proof shifts, it's much harder to get them out. And so that's not a reason to do a pilot. From the perspective of the Human Rights Code, the Charter of Rights in the AODA, creating new barriers is something that is not allowed. And here we have amply, and city staff have amply documented that allowing e-scooters will create new barriers in the city of Toronto. And city council would be doing it knowing, having been warned of it. So it would be intentionally creating new barriers, not maliciously, not because they don't like us or something, but once they're alerted, once they know, once their eyes are open, they can't later say, oh, shucks, we didn't know that would happen. And the new pilot, a pilot would create those barriers the moment it begins. We certainly know that from Ottawa and from other communities. So it's not just a matter of allowing them permanently raises those AODA concerns. The AODA requires Toronto and all Ontario to achieve full accessibility, including in the built environment, by 2025. That's less than 4 years away. And Toronto and Ontario are not on schedule. As you heard from John Ray, things have been getting worse. Creating new barriers is about the worst way to act when you're already behind schedule at achieving a legally mandatory goal that the AODA requires. Hope that helps.
David, thank you for your answer. Jason, do you have any follow-up questions?
I suppose my question would be, David, can you see any way that this pilot could be made AODA compliant, or is it something that there really can't be an accessible accommodation for the?
Oh no, we've looked at that, and like here's I'm going to give just one, because I know we got other speakers, the time is tight. I want to give you just one illustration. Everything that the e-scooter companies have proposed as ways to try to address this works on the assumption that we are going to allow these, and if somebody breaks the law, there's going to be some kind of enforcement. Well, we've already heard that the city doesn't have the staff for that kind of enforcement. But there are two other problems. One is that by the very nature of what e-scooters are and where they'd be ridden, you need to have a cop on every corner. And we just don't have that, and frankly, you know, what kind of city do we want to be where we have to have a cop on every corner just to help these e-scooter corporate lobbyists make the money they want to make? But the second problem is, I am blind, and if you are going to enforce any of the law, whether it's prosecuting someone for breaking a bylaw or suing them for the injuries, the very first thing you got to do is you've got to prove who the person was who broke the law, who it was who hit you. That requires proof of the identity of the actual person riding the e-scooter. Well, how on earth am I supposed to do that as a blind person? Moreover, sighted people are going to face problems, because if somebody comes at you silently from behind, knocks you over, you go flying to the ground, and then they go whizzing off into the sunset at 20 kilometers an hour, you are not going to be able to provide the kind of visual identification that is reliable. And we know in the law that eyewitness identification evidence is hard to prove at the best of time. I've argued cases on that at high-level courts on it. So for example, and let me wrap up with this, when we heard from Ms. Lowe that one of the ideas that the e-scooter companies were proposing is, well, what about stronger penalties or suspending people if they are repeat offenders? Well, that presupposes you can prove that they offended more than once. You got to prove they offended at all. This eyewitness identification problem is going to be a serious problem that would preclude any of that. And all of that makes the idea of having an e-scooter pilot to test the impact of it really just a backdoor way of saying, let us into the market, people are going to get hurt, sorry, too bad. Back to you.
Thank you, David, and thank you, Jason, for your question. Are there any other members who have questions for the speaker? Okay. Sorry, Glenn, I do see you. Sorry about that. Please go ahead. You have the floor.
Thank you. It's a rather short, straightforward question for David. You mentioned a three-pronged response that you recommended, rather, that the committee present back to the city. Would you be able to forward that to the city clerk's office so that we might be able to read that recommended response?
In the brief that we submitted this week, the text of it is there. So, and if staff need access to it, and if they need again, I'm happy to provide it.
Okay.
Thank you, David.
Yes, and thank you, Glenn, and thank you, David. The communications from David Lepofsky is also in your email. Any other members from the committee, visiting councillor, who would like to ask questions? Okay, seeing none and hearing none, I'd like to invite Jennifer Griffith to take the floor. Jennifer, are you there?
Yes, I am. Can everybody hear me?
Yes, we can hear you clearly. Go ahead, please.
Thank you so much. My name is Jennifer Griffiths. I am totally blind, soon to be a senior within a matter of months. I use the services of a lovely guide dog as a mobility aid to help keep me safe in this increasingly inaccessible and dangerous city. By dangerous, I mean, as John Ray so eloquently stated, we have construction. I'll go a step further. We've got construction coming out of our construction. I don't always know where to put my feet from one day to the next when I do have to go out. Secondly, again, we are in the throes of a pandemic. The city must continue spending much needed money, time, and resources to deal with the horrific inequities that have been brought to light. If these e-scooters come in, these deadly murder machines as I call them, I'll have to stay indoors, never go out, unless I continue getting the services of Wheel-Trans, and I will unabashedly and unapologetically expect to get them. Because I will not be able to take public transit, because it'll beg the question, every time I go out, will each time be the last? Will I sustain injuries? Not only would I have to deal with the trauma of the physical injury, but there's a strong possibility of post-traumatic stress disorder. Something to think about. I don't know how anybody could have voted for such a pilot project that they knew next to nothing about because they weren't thinking. I would ask the people who voted for this project to consider, what if one of their loved ones was injured or killed as a result of an irresponsible e-scooter driver? They might be singing a different song and dancing to a different tune. And the citizens of Toronto all pay the same amount, well, not the same amount of taxes, excuse me. We all pay taxes, be it through property taxes or other ways. And the city would still expect us to pay the same amount of taxes while our freedom of movement would be seriously curtailed. And I don't think that's fair. I know if it weren't for the AODA and other groups, I wouldn't have heard about this potentially dangerous and deadly pilot project. And as David and everyone else said, we can't expect to have law enforcement on every street corner or sidewalk. And I can't see, and I won't be able to, and there's deadly silence with these e-scooters. So we won't be able to hear them. Okay, this ends my speech. It's not the best, but this is the first meeting of its kind I've attended.
Jennifer,
thank you very much.
Thank you so much, Jennifer, for your remarks, and I thought your remarks were excellent. Are there any members from our committee who have questions of the speaker? Visiting councillor, seeing none and hearing none. Jennifer, with our thanks. Our next speaker is Colin Stark, followed by Chris Schaefer and Mary McDonald. Colin, are you there? Colin Stark? Okay, so I'm going to skip over Colin, but I will call his name again afterwards. Maybe he might have been disconnected. Our next speaker is Chris Schaefer. Chris, are you there?
I'm here, Councillor.
Hi, Chris. Welcome to the committee. You also have 5 minutes. I'll start your clock when you're ready.
Thank you. Good morning, Advisory Committee members. My name is Chris Schaefer, and I'm VP of Government Affairs at Bird Canada. As you may know, Bird Canada is a first and last kilometer e-scooter sharing company. We're also very proud to be Canadian owned and operated. I'll note too that with my friend at Lime, Jonathan Hopkins, who's speaking later, we were proud to have hosted last fall in Toronto a e-scooter accessibility roundtable. I do want to, off the top, note that I think the fundamental question, frankly, before this committee, but also City Hall, is whether we continue to ignore the growing number of e-scooter riders on city streets today, or whether, in fact, we choose to regulate this space with sensible regulations. I know, Councillor, I have the privilege of living in your ward, and I ran into you last fall, and our conversation was about exactly that, the growing presence of e-scooters on our street, despite the temporary ban on e-scooters in the city of Toronto. In fact, just yesterday, I was reading the Toronto Star. I'm going to quote from a headline. E-scooters are selling fast in Toronto, retailers report. The catch, they're illegal on city streets. So I think the time has come to lift that temporary ban. And in doing so, City of Toronto isn't alone. It can look to over 100 cities around the world that have in place regulations to govern e-scooters. Cities such as Stockholm, the birthplace of Vision Zero. Closer to home, we can look to cities like Kelowna, Calgary, Edmonton, Ottawa, Montreal, Westmount, Waterloo, that have all had shared e-scooter pilots to date. There are also over a dozen cities in Canada that are in various stages of regulatory development towards potential e-scooter programs. Closer to home, we can look to Ottawa. I'm going to quote from Councillor Tim Tierney, Chair of the Transportation Committee at Ottawa City Hall. There's been a lot of thought put into this, and touch wood, it's probably been one of the more successful pilot scooter projects across the country, if not throughout North America. It has set, quote, a new gold standard for other municipalities looking to implement. Ottawa just voted this month to continue their e-scooter program and in fact expand it. Calgary voted earlier this year to, after 2 years pilot program, to make that program for e-scooters permanent in the city of Calgary. Edmonton is now in their 3rd year of e-scooters locally. The fact is Toronto has a lot that it can look to in terms of it successfully regulating this space, and a lot of that solutions were pointed to by staff in the presentation today. I think Toronto also benefits from being a large city like a Vancouver and a Montreal. And why is that important? It presents possibilities for solutions that wouldn't work in other smaller cities in Canada. And one of those solutions, I think, and I would recommend to the city, is a lock-to e-scooters. It's a lock like a bike lock attached to a shared scooter that is locked and unlocked via the e-scooter app. A rider takes a picture at the end of the trip as an accountability mechanism to show the scooter lock to permitted municipal infrastructure. In Toronto, that's a range of things, including bike racks. Peer cities that reviewed them, lock-to scooters like San Francisco and Chicago, found dramatic decreases in not only sidewalk riding, but misparked scooters where they existed, and dramatic declines in complaints to 311. I want to spend some time also on e-scooter safety. I'm going to quote from the International Transport Forum. A road fatality is not significantly more likely when using a shared standing e-scooter rather than a bicycle. The risk of an emergency department visit for an e-scooter rider is similar to that for cyclists. In fact, in Montreal, there were dramatically fewer injuries on e-scooters as compared to e-bikes. In Calgary, 2020, you had 42 emergency room visits for an e-scooter rider, 484 for bicycles, 0 ICU visits for e-scooters, 3 for bicycles, 0 fatalities for e-scooters, 3 for bicycles, and the list goes on. Calgary permits sidewalk riding for e-scooters in 2019 and 2020, with over 1 million rides, or close to 1 million rides in 2020, only 4 minor injuries from an e-scooter to a member of the public. And despite this, Toronto staff are recommending third-party insurance coverage that in fact does not exist in North America, is not required anywhere else in North America, and is in fact not mandated or provided by Bike Share TO. Thank you for your time today, and I look forward to any questions you may have.
Thank you so much, Chris, for your deputation. I would like to make a request for the committee members. Do any of you have questions for the speaker? Or also, I would like to acknowledge that Councillor Fletcher is here, if Councillor Fletcher has questions. Okay. Seeing none and hearing none. Chris, thank you very much for your deputation. Our next speaker, thank you. I'm just going to call Colin Stark, if Colin has joined us again. Colin, are you here? Okay. If not, I'm going to proceed to Mary McDonald, followed by Jonathan Hopkins, and then Ron Redham. Mary McDonald, are you here? Okay. If you are here, if you can unmute yourself. Calling once again, Mary McDonald. Okay. I will call. Hello, who's speaking? Okay, no problems, folks. We're going to come back to these names, Colin Stark and Mary McDonald. I've put you into a placeholder. I will come back to you. Jonathan Hopkins, followed by Ron Redham. Jonathan, are you here? Jonathan Hopkins? Okay, I will also put you in that little placeholder. Ron.
Yeah, this is Jonathan.
Oh, hi,
Hello,
John.
This is Jonathan.
Hi, Jonathan. Welcome to the committee. If you can just count to 3 for me, I just want to make sure I can hear you clearly.
1, 2, 3.
Okay, perfect. You'll have the floor in 5 minutes when you're ready.
Okay, thank you, Chair and members of the committee. My name is Jonathan Hopkins, and I've been a traffic reduction advocate my entire life for environmental and vision zero purposes. I now work at Lime for the very same principled reasons. Scooters are a transit connectivity solution, just like Bike Share Toronto, for the 43% of our users who never ride bikes. 20% of our trips are connections to transit. Moreover, 80% of our riders say that when scooters are present, they visit local businesses more, aiding our communities in a time that we're trying to recover from a pandemic. Scooters are essentially a bike share type solution that does not require a 55% municipal or contributor subsidy as bike share does across North America. for people who just happen not to be enticed to ride bikes, plus those who are happy to ride both. This solution provides real value to communities, hence the global embrace of this mode in most major cities outside of Toronto. At Lime, we appreciate the city's focus on ensuring an accessible community, and we thank Janet Lowe for her presentation. We embrace the approach of focusing on safety for all road users with the goal of truly achieving Vision Zero. This committee has heard many things today, but we want to point out a few key and critical facts in this discussion. First, almost every city that has started an e-scooter program still has an e-scooter program. In Calgary, where city data shows scooter injuries were far, far less than bike injuries, and in Ottawa, the votes to continue our program were unanimous or nearly so. In all of these cases, they view the environmental benefits, the economic benefits, and the safety benefits as outweighing the risks, and that the risks are manageable and solvable, reflecting the balance of testimony they heard. Toronto's peer cities of London, Paris, Seoul, New York, LA, Vienna, and Britain all have scooter programs operating now or about to launch within the next 2 months for the same reasons. Furthermore, cities like Boston, Philadelphia, Melbourne, Sydney, and other major cities that Janet Lowe stated earlier are simply awaiting state legalization in order to launch programs. We agree that parking solutions should be addressed. The industry has recommended to the City of Toronto that the best-in-class solution is to do Lock 2, as we do with bikes. 99% of scooter riders in Lock 2 cities comply with the mandate, much better than car parking compliance in San Francisco and nearby Chicago, where parking complaints are down 80% as a result of Lock 2. This is a solution that works, and Toronto should embrace it. We at Lime support Vision Zero. True Vision Zero embraces best practices on mobility and focuses on where data shows the real problems are. In fact, the data says scooters are a Vision Zero solution. The OECD says in their the most extensive report in the world on micromobility, that road users will be safer, all road users, if e-scooter and bicycle trips replace travel by car or motorcycle. In fact, in over 1 billion trips by shared micromobility worldwide, there's yet to be a recorded incident of a related pedestrian fatality out of 1 billion trips. Oslo and Helsinki have taken this to heart. In 2019, they had 0 deaths on their streets. The same year, they had 5,000 to 12,000 shared scooters on the road. That same year, what did we see in Toronto? In 2019, Toronto had 0 shared scooters on the road and 42 pedestrian fatalities, or 65% of all traffic deaths. This is the real menace if we want to address pedestrian safety, but I've heard nothing about that spoken today. These are not deadly murder machines. They are tools that create more people-focused cities that can be absent the need for multi-ton vehicles plying our roads at high speeds. Not much has changed in the history of the car. In fact, when cars were as young as scooters were, they caused 168 deaths on the streets of Detroit in 1915, 75% of whom were pedestrians when there are only 65,000 cars in Wayne County. We have still not solved this problem 100 years later, but micromobility is globally recognized as part of the solution. The OECD makes 10 recommendations for safety related to micromobility. They include, 1, allocating space for it. That's protected bike lanes. When we install protected bike lanes in cities, they reduce pedestrian deaths by 44% and injuries by 50%. Scooters cause this sort of infrastructure to be built because it grows the share of population that would use it. In fact, 78% of scooter users never use public bike share and 45% never use bikes to get around a city. Safer mobility lanes mean safer pedestrians. We don't get there without growing the share of people using it. A Toronto with only bike share and no scooter program will be a Toronto with more traffic violence as a result. Number 2 is to make road users safe, focus on motor vehicles. I quote, "The novelty of e-scooters should not distract from addressing the risk motor vehicles pose to all other road users. Where vulnerable road users share space with motor vehicles, speed limits should be 30 kilometers an hour or less." This is not anything that we discussed today. Number 3 is regulate micromobility as bicycles. We agree, and that's why we're suggesting Lock 2. When we implement these benefits, these practices, who benefits? In part, 8% of our riders who have physical disabilities and use scooters as a liberating tool to explore the city, including the elderly. We have many riders in their 70s who have balance, but leg pain or mobility difficulties, and this provides them freedom. Or users that use our Lime Able program that provides delivery of adaptive e-assist and manual mobility vehicles for rental for people with a variety of mobility needs. or the businesses that I mentioned earlier that get help in a recovery.
Jonathan, if I can have
We will
your
not have safer
final
roads
thought,
by
please.
maintaining, thank you. We will not have safer roads by maintaining the status quo. If we actually want to lock arms and address big corporate lobbyists, that relates to oil companies and big auto companies that are actually making our cities less safe. We can make a difference here, and part of that actually is creating more people-focused cities that micromobility allows. We thank you for your time and support of a safer city.
Jonathan, thank you for your deputation. Are there any other questions for Jonathan? Go ahead, Liv. I see your hand.
Thank you, Jonathan. I have a couple of questions. You invoked Vision Zero, which is not specific to motor vehicles. It's specific to creating fewer injuries on city streets and in public space. And it's hard to square that with the data that we heard from the city staff around the number of injuries that are occurring as a result of the use of scooters on sidewalks, but also as a result of intoxicated folks using scooters. So I'm curious about the invocation of Vision Zero. And my second question is about this notion of micromobility. The data that the city staffers presented to us indicated that in at least one location, 76% of folks using the scooters were using them for recreation rather than for commuting or purpose-focused transportation. So I'd love to hear you speak a little bit to that as well.
I think both of those are great questions. First on Vision Zero. You talk to traffic engineers or anybody that studies this, we know that every mode of transportation incurs some sort of risk because you're on the roadway. And so, traveling on any mode, there's a risk, whether you're walking or anything else. What the data shows very clearly is from the OECD that studied this in, they have 20-some advanced member nations that they studied this in. And the data shows that fatalities are less if somebody's riding scooters, replaces a car trip with a scooter or bike trip. That the evidence on that is incontrovertible. A lot of evidence that gets quoted by people is saying that, scooter injuries were higher in 2020 than they were in, let's say, 2015. And that's really akin to saying that car fatalities were higher in 1910 than they were in 1890, because there weren't shared scooters in years prior. The injury data, again, the OECD reports that injury rates are not dissimilar on scooters to bikes. And again, if we shift people away from cars, then we will, help achieve this. The second question you asked, where I think it's Ottawa data that showed a lot of trips were initially recreational based out of curiosity, actually demonstrates the value of this back to Vision Zero. Scooters invite people who have never thought about getting on a bike for whatever reason to try something new. And the proof is, once they try it, they end up supporting it. Our data shows that only 13% of scooter trips are trips for recreational purposes only. And that's not necessarily a bad thing by itself either. It's people getting out and about. Like, we don't accuse people of walking around the block of misusing the sidewalks for recreational joy walking. But this is used for very meaningful, major purposes. About 40% of our trips are people commuting. Another 40%, 42% exactly, is people doing errands, shopping, dining, or entertainment, meaning they're buying something in our local community. And finally, about 9% of our trips are somebody going to public transit. These are real transportation purposes. The North American Bike Share Association says, and this is a bike share association, says that 41% of scooter trips are replacing a car trip. That same study finds only 29% of bike share trips do the same. They also find that bike share trips, 20% of them are replacing a transit trip, whereas only 8% of scooter trips do so. Fundamentally, the data for scooter share and bike share looks very, very much the same on injuries, on trip purpose, on how it changes the city. The only thing that is different is scooters are new, and that people who don't ride bikes happen to like scooters, just like many people who do ride bikes. Those are the two key things that are different. It achieves all the same goals related to Vision Zero. to economic development, to mobility, and is more effective at reducing car use, which is where 42 of our 60-some deaths a year in Toronto happen. Street deaths are to pedestrians. So I think that, does that answer both of your questions?
Thank you.
Thank you very much, Liv. Are there any other members with questions for the speaker?
Madam Chair, it's Jason Michelle again, Madam Chair.
Yes, hi,
Sorry,
Jason.
can you hear me?
Yes, I see you and I want to recognize you. And I think after you might be Wendy Porch. Thank you. Jason, go ahead, please.
Thank you, Madam Chair. So I just have a question for the gentleman speaking, both gentlemen from the e-scooter industry. You seem to be making a lot of comparisons to bicycles. I'm wondering if you can comment on the fact that e-scooters are motorized vehicles as opposed to bicycles, which obviously are not. And although perhaps the levels of accidents or injuries may be similar, can you comment on the fact that e-scooters are motorized vehicles, the drivers are unlicensed, and the speeds are well above 20 kilometers an hour? So compare that to a bicycle, which oftentimes will be ridden at much lower speeds in the city and are not motorized. Is that a fair comparison, being that one vehicle is motorized and one's not?
I think it's a really important point to bring up. And so then on that, just a couple quick facts about it. The average speed of an e-scooter rider is about 15 kilometers an hour. The average speed of a bike rider without e-assist is about 15 kilometers an hour from nationally recognized peer-reviewed studies. So the speeds that people ride these vehicles is about the same as a traditional bike. Secondly, significantly, our bike experiences are e-assist as well. I think companies selling e-bikes in North America are seeing a tripling in 2020 and 2021 of bike sales, which is actually generally viewed as a good thing because it makes the bike, makes biking a more accessible experience, to people who live around hills or to people who are older. In fact, there's data that shows that e-assist bicycles, if somebody rides an e-assist bicycle 3 times a week and they're elderly, they have higher 3 times a week, they have higher mental acuity at the end of the year than somebody's riding a pedal bike. So, e-assist is actually viewed in bicycling as a potentially productive thing. And that can provide the same benefits in some ways, like making it more accessible to people by having e-assist in scooters. The one thing that does not exist for private e-assist bicycles and private scooters, again, these things are very comparable, as you bring up. The one thing that doesn't exist for private ones is any sort of speed controls. I mentioned before, the average speed of a regular bicyclist is about 15 kilometers an hour. But people can get private bikes that go 30 kilometers an hour, 35 kilometers an hour. And people can get private scooters that go and soup them up to make them go 30 or more. In fact, somebody in Poland was caught riding a private scooter at 48 kilometers an hour. There have been no deaths related to pedestrians for shared scooters because of that speed control as part of the reason. So this is yet another reason, like Chris mentioned earlier from Bird Canada, that there's that report that private scooters are flying off the shelves and they have no speed controls and they have no geofences for parks or along the quay or any place else like that. Private scooters do. So it gives people a more controlled option that the city and the companies can collaborate on what those controls are to create a safer system. If we don't have this, the demand for scooters is still going to be there and people are going to buy their own and they're going to have no speed controls. This is a safer, more regulated, more collaborative approach. So I think your comparison of bikes and scooters and e-assist is really apt. Bikes are getting electrified too during the same years we're seeing this. And the solutions to both are the same. Regulate the speeds, work with the city, and then use that to give people, with many of whom have mobility challenges, more options to get around the city so they don't have to take a car, and it's better for the environment and it's better for public safety.
Thank you. Jason, is there a follow-up question?
Thank you. I mean, I think what I was questioning is the comparison between e-scooters and bikes a fair one, but you've answered that question, so thank you.
Okay, thank you so much, Jason. Our next member to question is Wendy.
Thank you, Councillor. Thank you, Jason, for your presentation. I'm also sort of puzzled around why there are so many discrepancies between the data that we've heard from city staff in the report that Janet gave earlier today and your report on very similar issues. So one in particular that I wanted to ask you to maybe comment on a little bit more is why did you say that there are no cities that started e-scooter programs and stopped them, when I think that's what we heard from the city staffer earlier, was that there are programs that have been started and then have been abandoned and or significantly reduced the speed of the scooters and also access the numbers of the scooters that are on the road. So could you comment a little bit on that? I also want to ask, so my second question is, just generally, you've heard from a number of people here today about what their accessibility concerns are. You've heard that people are concerned that they're not going to hear the scooters be injured. You've heard that people are concerned that the scooters are going to be left around and they're going to be injured as a result. I didn't really hear that much from you about how you propose to address some of these serious concerns. If we're talking about the AODA being the law of the land currently, and that we don't want to impose additional barriers in terms of the city here for people with disabilities, how do you respond to what to me looks like we are really talking about including new barriers here? So two questions for you, just, one about some of the disparities, I think, between what we've heard from staff and what we've heard from you, in particular on programs starting and stopping. And secondly, can you speak in a little bit more detail to how you think that you can be AODA compliant in a rollout of an e-scooter pilot?
I think I appreciate the question very much. First, on the number of cities, I said virtually every city has continued those programs. There are a couple that have stopped. Montreal is one of them. We're confident that in a future year, Montreal will embrace the same, based on our discussions, will embrace the same solutions that we proposed for Toronto. There are only a couple others across the world that don't have an e-scooter program. Out of a couple hundred that started, there's only a couple that don't currently have one. With respect to discrepancies on the data, I think the best thing is to look at the overall reports that were given by those cities and by global reports, right? If the city councils in those cities only saw the data that was presented today, they probably wouldn't have voted unanimously to continue the program. But the information that they are getting may differ from what you're seeing today. And they, based on a balanced view of the benefits and of comparable safety statistics, including, Calgary, where, there's been people getting killed on bikes and in cars and on motorcycles, not on scooters, where injury rates and bikes and and cars have, gone up by 30 to 200% this year, but increased very minimally on scooters. Or has had basically no change on scooters. Those are the sorts of data points that they're looking at, and those were not presented today. With respect to vehicles being left around and compliance with AODA, basically what the industry has proposed is do all the same best practices with scooters that we do with bikes. That does not mean that there needs to be docking stations like Bikeshare Toronto everywhere in the city, because that defeats some of the value of people having a convenient option, but lock the vehicles up as we do bikes. And if we follow those practices, and we say that scooters are non-compliant with AODA, that would be also saying that bikes are non-compliant with AODA, right? Cities other than Toronto have solved the lack of parking rings or bike parking. They've used scooter share as a way to help solve that, to create additional bike parking corrals that are public and shared, where you can lock up a bike or you can lock up a scooter. The bottom line is build a system where scooters operate as bikes in the bike lane, are locked up like bikes, and leverage the presence of scooters to make that sort of infrastructure more ubiquitous in the city. Because again, the status quo can't hold if we're going to achieve Vision Zero. We have to do something more. And scooters actually offer a pathway to do that. They invite more people in who favor bike lanes, who favor bike parking infrastructure. People can lock the scooter to them. They can go about their daily lives, and it can save a ton of car trips. So again, you mentioned scooters being left laying around. 99% of the parking in San Francisco and Chicago is compliant. People parking, locking the vehicles up appropriately, just as they do bikes. That's not being left, around, laying in the middle of the sidewalks. And that is, again, a much higher parking compliance rate than we see with cars. So we've proposed solutions here that, including like the sidewalk detection to keep people from riding on sidewalks. Those two solutions get these to act like bikes. And then we get all the same benefits of bikes, but to a much larger population.
Thank you very much, Jonathan. And we have now got to move on. Our next member to ask questions would be Miranda.
Yes, thank you so much. My question was actually a little bit similar, and I think the speaker just kind of answered some of my question that I had. My question was if you could speak a little bit on the data in terms of risk assessment in a Toronto context. What would be some of the risks and what you would suggest in mitigating the risks?
So, and I think we've appropriately addressed the highest priority areas. Those would be parking compliance, riding, not sidewalk riding compliance, and riding while intoxicated. For all of these, I think we should recognize that, we have made some progress on cars in those same areas, and many of the same tools apply, right? So for parking compliance, when you have 99% of the vehicles parked correctly, it reduces the amount of enforcement that anybody has to do. The city can do that enforcement and easily, just using a code, pass it, depending on city and provincial rules, pass on tickets through us like you would do to a car rental in a car rental company. Avis doesn't pay for a misparked vehicle, the driver does. So passing through tickets, this is what Seattle, Portland do, Calgary is looking to do. Passing through small, like $15, $20 tickets, we pass it on to the rider. That improves compliance. Education combined with enforcement are very good tools there. Additionally, the companies can play a role in auditing photos as we do in Calgary. So when people show that they didn't lock their vehicle, they can get a fine. And even our teams could pass on fines. So that could be a way of augmenting limited, by law enforcement or police service capacity. Sidewalk riding is similar. Education is key, but not enough, right? Like we can educate people about not speeding in cars. It's not enough either, right? So a degree of enforcement by putting the large placards on the front of the vehicle with numbers. It's basically like a license plate, but it's a sticker that has been pioneered in Portland, used in Seattle, again, copied in Calgary, Boise, Spokane, probably will be done in Ottawa. That allows people to be given tickets for riding on the sidewalk. The sidewalk detection can also help with that. It helps with, reminding riders afterwards. We can call riders that have multiple cases of it. We can also share the data of where sidewalk riding appears to be happening a lot in a big data format. Because this is 95% accurate, we can tell if somebody's riding on a sidewalk or not. We can share that with the city to indicate, corridors that people maybe would prefer protected bike infrastructure, which over 80% of people, if there's bike infrastructure, will inevitably ride on it. And that can aid the city in identifying gaps. Maybe there's not a plan for a bike lane on that corridor in a bike master plan somewhere, and it should be considered to be added. Or in the nearer term, we can focus enforcement on those corridors using city staff or even our team members. If they're out and they see scooter number 1234 riding on the sidewalk, we can pass on a warning or a fine. And then for, drunk riding, it's still like enforcement is a component, and there's some tech tools that some of the companies have come up with to, help us identify if somebody doesn't have maybe the acuity that should be on a scooter, and then to deny them a ride. So I think those are the biggest areas. Education, the solutions being education, a degree of enforcement by the city, by us as well, and then infrastructure for parking of vehicles and for riding of vehicles that we all should be collaborating with, the advocacy community, whether it's Cycle TO or the disability community and us, we all should be on the same side on this. And actually, that's what's happened in many other cities. Disability advocates, they hold us to account, as they should, but then we all work together on building that infrastructure that keeps people who are going, 4 or 5 kilometers an hour on a sidewalk safe from everything else that they shouldn't be exposed to, right? People biking, people scooting, and people driving their cars. Protected bike lanes make those corridors, when you install a protected bike lane, those corridors end up 45% lower fatalities and 50% lower injury rates on corridors with a protected bike lane than those without, based on a 13-year study of nearly a dozen cities in North America. So that clearly, it's the longer term and essential solution.
Jonathan, thank you for your very robust answer. Are there any other questions from committee members? Seeing none, thank you, and hearing none. I would like to move on. Thank you, Jonathan, for your deputation. Our next speaker is Ron Redham, followed by Paul Michaels, and then Adam Roy Cahoon. Ron, are you here? Ron Redham. If you can unmute yourself and just let us know if you're on the line with us.
Ron is here.
Okay, hi,
1, 2,
Ron.
3.
Ron, we can hear you, so please proceed when you're ready.
Okay, hi. Thank you, councilors. Thank you, committee members, for allowing me to speak. Hello, my name is Ron Redham. I'm a 60-year-old disabled person who lives in Etobicoke. I speak for myself and for no other group that I belong to. In 2011, I became disabled and spent 6 months in a wheelchair, then 6 months using a walker, and since then, canes. I am still disabled. It took a lot of work and therapy to get where I am now. Please do not send me back to a wheelchair to start all over. Do not send your grandparents or parents to the same fate as me. Please stand on guard for me and other Canadians like me. E-scooters do not fit in our city right now with COVID. Lack of walking areas, narrow roads, limited bike paths, and normal able-bodied people out for a walk as well as disabled. To us, these are equivalent of a drive-by accident waiting to happen. We all know the accident rate with these will be huge. And who will pay for the damage caused? With no driver's license, training, or insurance required, how can we trust the rules of the road will be followed and obeyed? It is a recipe of turning our city into the Canadian capital of disabled people. Other Canadian cities we've heard have tried e-scooters with dangerous results. In Montreal, 80% of riders park scooters illegally, resulting in scooters littering throughout the downtown and an early cancellation of their pilot project. In Calgary, we heard there were 700 emergency room and urgent care visits due to scooter-related injuries. In just the first year of their pilot project. Every city in the world that has allowed these has experienced major problems that the commercial owners claim are not theirs, but it needs to be. They must claim ownership.
Ron, does that conclude your remarks?
No, I'm sorry.
No problems. Please continue then.
Okay. E-scooters act as a barrier to access or a hazard to access subway stations if any depots are located near them. And through the use of bike pathways near stations for people with disabilities, low sight, or hard of hearing, deaf. Like quiet disability sharks, these units will find their prey. The hazard has been well documented in all pilots before. Wheel-trans or the disabled will not be able to safely access subway stations, thus limiting family of services use by TTC. Already, we, the disabled, have enough obstacles around subway stations. Even with speed limiters, even set to the maximum of disabled walking speed, many people cannot hear them or see them. There needs to, we need to have no power riding near subway stations due to the amount of people during rush hour and the people getting hurt. And when people get hurt, there'll be no insurance. These rental companies must provide insurance for riders with no limitations, mandatory with rental, so the city does not get named in a lawsuit, which it will be named if no one is insured. And automatically, they need to add the insurance to the cost of the rental with no fault for those without insurance. And there needs to be full indemnification for the municipality by e-scooters riding companies, and not limitations in their indemnification contracts. No free ride to anybody. Speaking of which, there'll be significant costs to the city. Signs, space, road markings, enforcement. This needs to be included as a fee automatically added with rentals. And automatic fines billed to the rental person, no matter who's riding it.
Okay. Ron, can I get your final thought, please?
I'm trying to get there. We've heard that there can't be baskets or cargo, and only one person per scooter, mandatory helmets, cannot be used in mixed-use areas. E-scooters cause more pollution. North Carolina University study and the MIT Technology Review reported they use more pollution than any other mode of traffic.
Thank you very much, Ron.
One last line, please.
Okay, go ahead.
This request to speak to vote is personal to me. I do not want to end up in a wheelchair again, nor do I want to see fellow Canadian citizens in one for the sake of someone's 5-minute pleasure ride and some e-scooter company's profit line.
Thank you very much thank you very much for your deputation. Are there any questions for the speaker? Seeing none and hearing no one. Thank you so much, Ron, for your deputation. I'd like to call.
Thank you for your time.
Thank you. I'd like to call Paul Michaels from B'nai B'rith, Canada. Paul, are you here?
Yes, I am. Can you hear me?
Paul, I can hear you very clearly. You also had a very loud echo. Maybe move away from your microphone a little bit and try one more time for us.
Sorry, this is Nahum with the City Clerk's Office. I've muted Paul Michaels for a moment. Paul, I believe you're connected to the meeting using 2 different devices, so the audio is looping. Please disconnect one device and only speak to the committee using one device. Thank you.
Is this any better?
Paul, it's not.
I'm sorry, Paul.
Go ahead, please. Go ahead.
I'm sorry, Paul, but it's not. So I am going to expel the device that did not unmute. So now I've expelled one of the Pauls that was connected that did not unmute. Please now unmute and speak to test.
Is this any better?
Much better.
Okay, okay. Well, first, thank you very much for the opportunity to speak this morning. My interest in this important subject is both personal and professional. Professional because I work for a national human rights organization, as mentioned, Neighbourhood Canada, that has a disability committee headed by Eddie Rice, from whom you've already heard very passionately, and whose work on a range of disability issues I've come to admire and to learn from. Personal, because in my own family, I have two close relatives who manage their lives as best they can with cerebral palsy, but who've asked me to impart to you their concerns about possibly facing the threat of injury because they won't be able to maneuver safely out of the path of or around the accumulation of e-scooters. I've my own growing mobility challenge, but I won't take any precious time to go into that, except to say that the professional and the personal have come together for me in solid support of banning the e-scooters outright, instead of just trying to regulate them as a compromise solution, an untenable one at that. And let me explain why I say that with reference to TAAC's own presentation. First, I commend TAC and especially Janet Lowe for reaching out to the accessibility stakeholders and identifying the key problems that e-scooters pose to those with disabilities, affecting not only their mobility, but also their immediate awareness of their surroundings. As Jennifer, for instance, passionately explained before, all of which puts them at greater risk of injury. Many things stood out for me in the TAC report, but time allows me only to mention just one, and it's very important. And actually, it goes to the heart of what David Lepofsky was talking about in terms of the hard empirical data as reported on page 14 of Janet's report. And I'm just going to quote from it again, because I think it's really important. E-scooter riders are 4 times more likely than bicyclists to injure others due to the e-scooters being illegally ridden on sidewalks, end quote. And moreover, that quote, in just 21% of e-scooter incidents with personal injury, the victim is not the rider, but another road user. This is due in part to e-scooters being ridden on sidewalks 60% of the time, 60%, when they should be on the road or on a bike lane, end quote. Other data show consistently a strong preference by e-scooter riders under different circumstances for use on sidewalks. Now try to regulate that. Among many other factors addressed by TAC, it's understandable why so many major cities in North America, including downtown Chicago and New York, and abroad like Copenhagen, have banned e-scooters since, as Agence France Presse reported last fall, according to the municipal councillor, quote, it is extremely difficult for seniors to get around when they, that is the scooters, are left lying about, which is to say nothing about the even greater danger that e-scooters pose to the disabled of all ages. I understand that feedback from TAC and accessibility stakeholders will be reported to the Infrastructure Environment Committee on 2 meetings on March 23rd and April 28th, and ultimately up to City Council. And I hope that this committee will recommend to maintain Toronto's current bylaw ban on e-scooters on, quote, public roads, bike lanes, cycle tracks, trails, paths, parks, sidewalks, walkways, and public squares, and that no exception will be made in light of Ontario's regulation 389/19, the pilot project on e-scooters. Do not allow the safety and well-being of pedestrians generally and the disabled specifically to be put at risk, no matter what commercial pressures are brought to bear by the $1 billion e-scooter industry. Thank you very much.
Thank you, Paul, for your remarks. Are there any questions from our committee members for the speaker? Okay, seeing none and hearing none. And I just want to double check because I don't see Jason on my screen. Jason, do you have any questions? Hearing none, seeing none. Okay, so we're going to move on then. Our next speaker is Adam Cahoon, followed by Kathleen Forrestal. then Louise Russo. Adam, are you here?
Yep.
Okay,
Yep.
Hi, Adam. You know our committee very well, so when you're ready.
All right. I just noticing the clock is still running from the last.
Yeah, no, I'm going to restart that for you, Adam. But Adam, if you're okay with this request, I'm going to ask you to take your video off just because we're struggling with bandwidth right now.
All right.
Okay, thank you very much.
Fair enough.
Okay, go ahead when you're ready.
Take it off before I start. Okay. The request I'm asking of you guys today is to really look at. I know right now everybody is saying shut the door, and I'm in the same light. And I definitely think, in light of the pandemic, these are why these e-scooter companies are coming to cities while the pandemic is on. They want the euphoria of the opening up of the city to actually make it so that everybody has fun racing and racing around. They're using some of the same playbook as some of the companies, as the automobile dealers used after the end of World War I and the Spanish flu. And some of the strategies from some of the unconventional stuff that was used after World War II to bring in stuff we really didn't need and have been suckered into. I am saying, no matter what, even if City Council wants to look into e-scooters, I firstly recommend that we do not look at any of the e-scooter rentals till 2023. And if the people, if like the industry is saying they want regulation, then let's regulate the people that actually bought their scooters first before we even think of letting these rentals in. These rentals are going to be as problematic as Airbnb has been to regulate in the age of social distancing. And even during this time, we have shown that it's the young people that are irresponsible and not following the rules, and other members of the population that are going to be these scooter users that are just going to dump them everywhere. And just sort of as one of the people campaigning today for the scooters who showed up on the phone with an anonymous number, there are going to be ways people are going to cloak the use of these things, and they are just going to be problematic. And I am shocked to know that their scooters are allowed to go twice as fast as my wheelchair, and even I get looks of death from people when I go full speed in my wheelchair at around 8 to 9 kilometers an hour. So I think we should limit the scooters to that time, that amount of speed. And I know why they're lobbying a city like Toronto so hard. They're scared that because we're such a big city, that if we ban them, other cities are going to be brave enough to follow us along and say, oh, we're going to do what Toronto did, which is totally ban these e-scooters in the name of accessibility and in the name of health and public safety, which is what we have done for COVID, is for health and public safety. We have banned all kinds of things that people would love to do, but it's not really in the best interest of the wider community. So I think we should take some of the lessons we've learned during COVID and as a city actually widely ban these e-scooters and really show the lobbyists that they aren't gonna break us like toy commercials used to break children during Saturday morning cartoons. Thank you.
Adam, thank you very much for your deputation. I will ask the committee members if any of them have questions for you. Committee members, visiting councillor, seeing none and hearing none. And I just want to double check. Jason? Hearing none, seeing none. Okay. Thank you very much, Adam, for your deputation. Our next speaker is Kathleen Forrestal, followed by Louise Russo. Kathleen, are you here?
Hello, are you able to hear me?
Yes, we can. It's very clear. Thank you.
Wonderful, thank you. Thank you, Madam Chair and members of the Toronto Accessibility Advisory Committee for the opportunity to speak with you today. Thank you also to Janet for your thorough presentation. My name is Kathleen Forrestal and I'm the lead for advocacy for CNIB Foundation in the Ontario East region. In June 2020, Ottawa City Council approved the first e-scooter pilot season. From July through October last year, these devices were operated unsafely and left discarded in pedestrian clearways throughout our city's downtown, causing accessibility barriers and safety hazards for our city's most vulnerable residents, including the approximately 54,000 Ottawa residents who live with some degree of sight loss. I have been engaging with city staff, councillors, and the sight loss community since the pilot launched last year, and we watched closely to monitor the impact of these devices in our community. In October, as the pilot season ended, we hosted a focus group for residents with sight loss to hear about their experiences with e-scooters. We invited city staff and councillors to attend and hear our feedback. We heard alarming stories of the safety hazards e-scooters posed to our residents who are blind or partially sighted. Unsafe operation, sidewalk riding, and improperly parked e-scooters were the most common concerns. It is worth noting that e-scooters were not allowed on sidewalks, and yet this was still a regular occurrence. I'd like to take a moment to share some data from an e-scooter survey the City of Ottawa conducted at the close of last year's pilot season. The most common reason for using an e-scooter was fun or leisure, and 76 of the survey respondents cited this. 69% of survey respondents encountered a misparked e-scooter during the pilot. And when they encountered these misparked e-scooters, 77% of respondents just left the device where it was. Only 12% of respondents reported a misparked e-scooter through any of the various means, including through e-scooter apps, through the phone number on the device itself, through 311, or through city councillors or staff. So the data collected by the city and the e-scooter companies doesn't even begin to capture the extent of the issues we encountered. Furthermore, 72% of respondents encountered sidewalk riding, and 39% felt unsafe when this happened. So I will let that data speak for itself. Despite our ongoing efforts and engagement with the City of Ottawa, and also the staggering data that the city itself collected, Ottawa City Council recently approved e-scooters for a second pilot season. On behalf of CNIB Foundation, I urge you to learn from our lessons. Don't permit e-scooters in the City of Toronto. In Ottawa, we are already in a position where we're trying to make the best of an unsafe situation. You're still in a position to avoid this altogether and protect your most vulnerable residents, and I strongly encourage you to continue to do so. Thank you for your time.
Kathleen, thank you for your presentation. I'll just turn to the committee members. Any committee members with questions for the speaker? Seeing none, hearing none. Thank you very much. Kathleen, thank you for your presentation. We have 3 speakers technically left, and we've got just under 15 minutes. We're going to try to do this. And that's before we break for lunch. Louise Russo, are you here? Louise Russo? Okay, I will put a little box there. Lucia Patera. Lucia, I know we heard from you earlier this morning. Have you managed to stay on the line with us? Lucia Patera. Okay. Our next speaker registered is Shoaib Ahmed. And I apologize if I mispronounced your name.
Not a problem, Madam Chair. Whenever you're ready, I'm happy to speak.
Okay, yes, please go ahead. I'll start your clock.
Hello, everybody. My name is Shoaib Ahmed, and I'm the founder and CEO of Scooty. We are a Toronto-based micromobility company based out of the Ryerson University's Digital Media Zone, and I'm here to talk about our positioning on e-scooters. We are a local team that fundamentally understands the needs of the Toronto, and we've heard some very strong advice and feedback here in this meeting, and our model specifically focuses on integrating with city services, working and supporting various projects that reduce municipal costs while emphasizing community benefits, and at the same time understanding the stakeholders that are going to be most affected by the implementation of e-scooters in any city. We have followed the Accessibility Advisory Committee meetings and recommendations and clearly understand, as also echoed in this meeting, and expressed by the committee members and the accessibility stakeholders. Our safety courtesy partnership approach can realize more of the benefits of e-scooters and challenges and concerns that the committee members have. And I would like to commend and big thank you to Janet Lowe, Ms. Janet Lowe, for her excellent presentation and support various recommendations. As a company based in Toronto, we understand and appreciate the challenges associated with limited space by many users. Scooty has and always have said that we have to understand and implement AODA requirements for clear sidewalk pathways and accessibility space, and view the hybrid recommendations or docking stations in areas or designated parking pickup and drop-off locations as the best way to organize e-scooters. And again, from the start, we've always said scooters should not be allowed to be ridden on sidewalks. We believe that the best way to meet the AODA requirements, as well as the concern of the membership and accessibility stakeholders, is to maintain a separation of the road user and the pedestrian. We have supported the city's project to redesign roads like the King Street and Yonge Street to make them safer to use and make more space available for pedestrians, cyclists, and various users and people with accessibility needs. We have supported the expansion of bicycle lanes, especially the separated network of lanes and the slow speed programs. And we're very pleased and encouraged by the expansion of the Toronto Bike Share and CE scooters as a complementary part of the active transportation mix. We fully support a phased-in approach to Toronto pilots or any pilots in the City of Toronto, starting with control sites and moving to community roads and Main Street as the understanding and adoption, while feedback from the public and various stakeholders increases over time. Our vision for micromobility is more than just beyond e-scooters and more than just downtown Toronto. We're focused on a sustainable long-term approach to increasing equity, especially mobility equity, while addressing concerns. Integrating pilots with programs such as Bike Share and Active TO would encourage more active mobility and local economic activity throughout the city, while representing, enhancing, and supporting social, economical, and public health benefits. Happy to take any questions and able to participate in this discussion. Thank you so much, Madam Chair and council members. for allowing me to speak at your meeting.
Okay. Thank you so much for your deputation. I'm just going to turn to the screen. Are there any members from the committee who have questions for the speaker? Seeing none, hearing none. Thank you very much, Schwab, for your presentation. I'm just going to go back and recall the names of speakers who are registered but were not able to join us. So I'll start with Colin Stark. Colin, are you on the line? After that would be Mary McDonald. Mary McDonald, are you here? Then Louise Rousseau. I believe she's back on the call. Maybe I'm wrong. Louise Rousseau?
Hello. Hello, this is Nahom with the City Clerk's Office. I see that Louise Rousseau is connected to WebEx. I see that they are also unmuted. Louise Rousseau, if you can hear us, please speak. Oh, okay. So Louise Rousseau is messaging chat. They can hear us, but we can't hear them. If you can give me one moment with them, please.
Okay.
Thank you.
Thank you. While you sort that out with Louise, I'm going to call Lucia Patera one more time.
Hi, Callie. This is Shoaib. I just
Okay.
my.
Okay, so we'll let the IT staff try to connect Louise Rousseau so we can hear her deputation. And just so you're aware, everyone on the committee, I'm thinking that we could probably break for half an hour, if that's okay, just to allow everybody to have a body break, to go grab a bite to eat, and we can reconvene at probably in 30 minutes after we hear from our last speaker. At that point in time, I will call the names of the speakers who were not here, who did not join us this morning. If they do join us in the afternoon, we'll hear from them. We'll go straight into questions of staff on their presentation and then into remarks. Just to give everybody a heads up on where my head is at. Great, thank you, folks. I should also ask, are there any members of the committee who cannot join us for the afternoon session? I hope everyone can come back. We need you for quorum. Okay, you're wonderful. I'm seeing some nods. You're so dedicated. I love you all. You're great. Oh, yes, Michael, I see your hand up.
Hi, I don't think I can make it this afternoon.
Oh, okay. Well, thank you for letting us know, Michael. Is it the 1 o'clock that you're struggling with? If we come back at 1?
I have a meeting at 2 o'clock.
Okay. If you can join us for that 1 hour, that would be incredibly helpful. Obviously, if you cannot, I would certainly understand. I see Liv, who also put her hand up.
I will be happy to be with everyone at 1. I do have a hard stop at 2 o'clock.
Okay, so I'm pretty confident we can get through the motions, go through the item by 2, but recognizing that we'll most likely lose quorum, we'll persevere to do everything we can to finish this matter by 2 p.m. and hopefully sooner. Okay, thanks, folks.
Okay, I appreciate that. I'll come here for 1, and with Liv, I'll leave at 2.
Okay, thank you. Then turning back to IT staff, how are you folks doing? Are you able to connect with Louise?
Hello, this is Nahom with the City. Yes, that should be Louise on the line. Thank you.
Yes, I'm on the line.
Hi, Louise.
Can you hear me now?
Yes, we can hear you.
Oh, great, good.
Go ahead when you're ready.
Yep, I'm ready. Thank you for all your patience here. Good afternoon, Madam Chair, members of the committee and the staff, and I'd like to thank Councillor Fletcher for joining us today. I wish the other councillors were able to jump in too. It would have been great. Anyway, thank you, Jen, for the excellent, informative presentation this morning. It was absolutely wonderful. My name is Louise Rousseau, and I'm a longtime resident of Toronto. In 2004, I was a victim of a violent crime which left me with high-level paralysis. I've had to learn to adapt to doing everyday normal activities differently and will use a wheelchair for the rest of my life. One of the ongoing struggles I deal with on a daily basis is trying to figure out if the places I'm going to will be accessible. Will I find a disabled parking spot? Are these curb cuts close by the entrance? Where is there the closest gas station that will assist me if I need to fuel my van? These are just a few of the things I didn't even have to consider before my injury, but now it's something I have to constantly think about before venturing out. When the issue of e-scooters was brought to my attention, I immediately envisioned the added stress it would bring to my life and the lives of anyone with a disability, and also the impact it would have on our seniors. The more research I did, the more I talked to individuals that had experience with these scooters, made me realize I had to speak up about this very important issue. Sure, the corporate lobbyists are going to make it look fun and easy to get around, but we know it's not the safe way. As you've heard from other speakers, e-scooters endanger public safety and are a hazard to both riders and innocent pedestrians that are seriously injured and sometimes killed. Scooters that are discarded and left lying around sidewalks, hindering pathways, creating accessibility barriers to anyone using a wheelchair, walker, or scooter. They are a danger to our seniors and a trip hazard for people with vision loss. I agree with John Ray this morning, his first presenter. Instead of Toronto becoming more accessible, it will just make it more difficult to get around. They're driven by uninsured, untrained individuals who are not wearing a helmet. Through my research, I've came across many publications regarding scooters, but this one stood out in Time magazine. It was written on February the 5th, 2019. Here's a piece of the content from that magazine. It's believed to be the first published study examining scooter injuries. Was released in January in JAMA. It's a network open, a peer-reviewed medical journal. The UCLA researchers studied 249 patients, 228 scooter riders, and 21 pedestrians, treated at 2 emergency departments over a year time. Head injuries and fractures were the most common diagnosis. Among scooter riders, 80% were injured in a fall. 11 collided with an object, and almost 9% were hit by a moving vehicle or an object. For almost 5% of all patients, intoxication was a factor. Just 4% of riders wore a helmet. Approximately 1 or 2 major trauma injuries a month are admitted to the trauma center. The reason is simple. It's who's carrying a helmet? No one. No one's wearing them because no one's carrying them. Such findings don't surprise physicians. They're seeing 5 to 6 minor injuries a week, almost 1 a day. Hands and arm fractures, broken bones, facial injuries, such as scrapes, bumps, and fractures. According to Dr. Oscar Trauma, ICU Medical Director at Vanderbilt University Medical Center in Nashville. Now, do we really need to add to the cost and the burden of our health system when we're already in a crisis situation? I want to thank the Toronto Accessibility Advisory Committee for the unanimous recommendation to Toronto City Council a year ago on February the 3rd, 2020, that e-scooters should not be allowed in Toronto. There's a reason why this Accessibility Advisory Committee was put together. It is our hope that our city officials take your recommendations and our presentation seriously and do what is best to keep all Torontonians safe. Thank you for listening and protecting those who need safe, accessible streets and sidewalks, not the interest of corporate lobbyists. Thank you so much.
And thank you, Louise, for your deputation. Nice to hear from you. I'd like to ask members if you have any questions for the speaker. Seeing none and hearing none, Louise, thank you very much for your time today. Recognizing that we're now recognizing that we're now at 12:30, I'd like to move a motion that, I'd like to recognize that we're going to break for half an hour and only half an hour, which means we'll come back at 1 o'clock. Do I need a motion for that? Yeah, so because we're amending our lunchtime from 1 hour to half an hour, I'd like to move that as a motion. All those in favor? Anyone opposed? Okay, thank you very much. We'll see you sharply at 1 o'clock. Okay, thanks everyone. And if you'd like, you can take your put your video on, take your video off and put yourselves back on mute, so you don't necessarily have to unlog from the meeting. Thank you. Welcome back, everyone, to meeting number 14. This is a special meeting of the Toronto Accessibility Advisory Committee. We are ready to proceed. I just want to, by way of courtesy, extend the invitation to speak again to those who were not able to join us this morning, but they were registered. So I will call your names one final time before we head into staff questions. Colin Stark. Mary McDonald. Lucia Patera. Okay, thank you very much. Seeing none. For those members who are here, if you are interested in asking questions of staff, you heard Janet Lowe's presentation from earlier this morning. You also heard from a number of deputants, and we're here to now take your questions. So I will start a speakers list to organize our speaking order, and if you can just indicate your interest of asking questions, raise your hand if you can, or unmute your microphone and let me know. Okay, Jason, I see you first. Following Jason, we will go to Liv, then Michael. Thank you, Michael, as well as Glenn. Anyone else? I can call again afterwards. Okay, so we'll start there. Jason, Liv, Michael, and Glenn. Jason, you proceed, please.
Thank you, Madam Chair. Just to clarify, this is for questions of the staff?
That is correct.
Okay, great, thank you. So I commend all of you on your excellent presentation. It was very informative and quite honest. So my question relates to the proposed insurance scheme. You mentioned that there would be a first and third party insurance, and someone from the industry said that that's never been done before. So who would bear those costs, and how would a potential victim be able to avail themselves of this insurance? And do you, even beyond that, an increase in potential litigation arising from e-scooter pilot?
Great. Through the Madam Chair, the first and third party insurance is something that is being required in other jurisdictions, as mentioned, like the UK trials, in Germany, in Malta. What it would be is that the e-scooter rental company would be required to provide the first and third party insurance as part of the rental. So that is the requirement that is in the UK trials right now. And the threshold in terms of the coverage would be something that we would consult our city's insurance and risk management office. It would need to cover the incident threshold for the city, which is currently $5 million per incident. And it is something where it is being done elsewhere. And we think that it's an important part of ensuring that a rider that is renting an e-scooter has consumer protection, and that if there's an incident where a third party, like a pedestrian, is injured, that there is that coverage. There would likely be litigation afterwards, because e-scooter renters click a waiver when they rent an e-scooter, and that waiver is something that would probably need to be it would involve likely some litigation, but the coverage up front would cover at least the third parties if injured. I hope that answers your question. In terms of the comment that it's not available, we are aware of insurance companies that are selling and wanting to offer these products. We don't believe it is the job of city staff to become the insurance broker for the companies. Right. We're thinking of providing that information to them, with a big caveat that we are not selling that insurance product. It is up to the companies to obtain it themselves. A number of the companies do operate in the UK, So they are already providing this in those trials.
So I was just commenting on one of the speakers this morning's comment that it seemed that they were being asked to do more in Toronto than anywhere else. He seemed to be almost lamenting the fact that they had to bear the cost of insurance. The other follow-up question I have is that have you obtained an opinion from City Legal on the potential risks to the city if litigation ensues during the pilot?
We are working with legal counsel on this issue, on the whole e-scooter file itself. We haven't discussed specifically litigation costs, but we have been discussing with insurance and risk management, and they do believe that there would be significant costs involved for the city if pursuing a pilot in terms of trying to recover a number of costs and claims, whether directly from members of the public who are hurt or with the companies. We are aware of other cities that have entered into litigation where the indemnification contract has not been upheld, and that's been in the news, where the city has also had to sue the e-scooter company for not upholding the indemnification contract, and then the city trying to recoup the legal fees of having to pursue that.
Thank you. So will this legal risk management be part of the report that's presented on April 28th?
Yes, we will. We consult a whole group of interdivisional city staff, and they are definitely going to be part of that drafting.
Okay, great. Thank you very much. Thanks.
Thank you, Jason. Next member to ask questions would be Liv.
Hi, Janet. Good to hear from you again, and thank you. I think you came back with a really comprehensive report that addressed a lot of the questions we had for you when we last saw you, and I really want to commend you for that and your whole team. My question, I have a few questions, but I'll address this one at the moment. Following off what was just asked, do you have an estimate of the cost to the city of a pilot between the insurance, potential insurance outlays, the infrastructure that will be required, the communications? What kind of costs altogether would there be to the city?
So we don't have a numeric figure. What we are aware of is that there would be the cost of claims, there'd be the cost of police enforcement, as well as city staff and transportation services dealing with the street litter, that piece of enforcement. There's the own city's data collection cost, as well as the just monitoring the compliance and oversight. So there's the staff labor costs in that respect. There are other costs too if we're shifting some of the trips. What we're seeing in the data is that trips are shifted from public transit. So there's other services and infrastructure impacts. It is a great question. I think what insurance and risk management is finding is that it would be difficult to come up with a numeric figure.
Thank you. That's the sense I was getting, is that the actual dollar amount would be an unknown going into this. The other question I had, I think we've mentioned to a couple of the folks following their presentations who are from the e-scooter industry, was that we seem to have different data from you and from their presentations. And I'm not going to go through all of the discrepancies, but I'm particularly interested in the injuries. And I'm wondering if you can speak to that at all.
Yeah. So there are a couple things I wanted to mention on that. First of all, the staff report from last year had an entire safety section that was vetted with Toronto Public Health. They are swamped right now, so they're unable to continue to work with us on this. They would typically be part of this process. The injury data has been spotty. Prior to COVID, there were a number of hospital studies, and I think it's very important to note the source of the study. So we've been sourcing academic studies, we've been sourcing studies from hospital researchers, and directly from Dr. Eddie Lang. I'm in direct contact with that German insurer's research group to vet what I've put in my report. The OECD ITF report, and I'm thinking of making it a public attachment, has a disclaimer on it that it is sponsored by a corporate board. That corporate board includes e-scooter rental companies and also e-scooter manufacturers. It includes a disclaimer that the OECD did not vet the report. It was not vetted by OECD countries. Even still, the data in that report in its entirety, so I'm amused by the comments about being taken in its entirety. On page 10 and 20 of the report, it says that the hospital rates may be higher for e-scooters, that hospital admissions related to e-scooter incidents may be higher. It says that there are too few studies and that evidence is weak. There's not enough data collected, and in fact, data is not collected on a per trip or per kilometer basis. These are on page 25 and page 26 of the OECD report. On page 25, it speaks to pedestrian injuries related to e-scooter incidences. It says that they're underreported and that there isn't good methodologies for collecting data on pedestrian injuries. It says that they can range from 1% to 14% of the injuries being to pedestrians involved in e-scooter incidences. I think absolutely that OECD report should be looked at in detail. We have been very upfront with industry from last year's report up until the January 20th industry group meeting. At the January 20th industry group meeting, we were very clear in saying that we do not consider, given the research that we've seen, that the risk profile of e-scooters is the same as recycling. And we believe that the preliminary research we've seen so far indicates that. And the big challenge during COVID in 2020 is that the hospitals have not been able to provide the kinds of studies and the resourcing for the type of research that we would like to see. And in fact, to do this properly, we would like to create a baseline with Toronto hospitals. I have a hospital network set up, but they're just not in a position right now for us to collect a baseline so we know what the status is in terms of injuries to persons with using different micromobility before a pilot, during a pilot, and afterwards. So we absolutely think data is very important, and the source and the type of methodology being applied is very important.
Thank you, Janet, for your answer, and Liv for your questions. If there is time or a desire to have a second round, we'll reopen it again. But at this point in time, I'm going to move to Michael. Michael, to question. Go ahead, please. Wendy, I see your hand. Thank you. Just call.
Hi,
Oh,
I'm
yes, sorry.
here. So, Janet, I would like to thank you for your presentation. My question has to do with the deafblind community. So if the e-scooter pilot program was implemented, what safety measures can be taken for deafblind individuals in particular?
I think we aren't right now in a position where we are advancing specific details of a pilot implementation given the process that we were directed by City Council. The kinds of solutions that we've researched that probably would hold the greatest promise, and Paris is starting to look at them and a number of other jurisdictions, is a docked system. So this is with respect to preventing the potential street litter and obstructions and trip hazards. Docked stations also, they will ensure that there are specific locations where devices are parked. In addition, it provides actually some reliability for users of the micromobility system to know where e-scooters and shared bikes and e-bikes are. I'd like to point out that Bike Share Toronto provided me with information. 43 of the TTC stations and stops have bike share. 9 GO stations have bike share. So the integration with transit is really key. And we would want an orderly system for having docked shared micromobility. In terms of the moving violations potentially with illegal sidewalk riding, that is much more challenging and difficult to address. And I'm afraid at this time I don't have something that would be certain in terms of addressing concerns of the deaf-blind community or blind or low vision or other pedestrians.
Thank you, Janet. What I'd like to do is ask, is it possible to have a tracking device in all the e-scooters so that we could, for example, see them on the map? We could see them moving around like we see cars in the Uber app.
So I believe that technology is advancing so that absolutely there would be able to be tracking devices. There are a couple of considerations. First is having a continuous internet connection. I've spoken with our data and analysis group, and there are some concerns about the reliability of continuous internet connections. There's also issues, as I mentioned, with the GPS, the global positioning satellite signal. So that can also be disrupted, or it can bounce around. So there are some potential methods. They're not all foolproof. We would also be concerned about privacy impacts, and we would be looking into the privacy aspect. There's some jurisdictions that are looking at even like remotely controlling some of the e-scooters. We're aware of all sorts of privacy and equity and social justice concerns with being able to remotely control the devices and some sensitive policing aspects. The other issue are the privately and personally owned. I don't believe it would require some sort of registration to ensure that both personal and privately used as well as rental had some sort of tracking. And again, as I mentioned, while there may be some technologies that do that, the reliability is questionable, and there are a number of privacy and social justice issues that we would have to look, and equity issues we'd have to look at for that.
Thank you. What I would like to do is just to let you know, Janet, that in addition to the other communities that we've talked about today, deaf-blind people are especially affordable because we rely on the assistance of interveners and support persons. And in the case of an accident involving an e-scooter, we may be separated from our support persons, and therefore not being able to understand or comprehend what is going on, I believe would be a serious concern. So I just wanted to put that out there, and thank you for your time. And I have 2 seconds left, so there we go. Bye.
Thank you very much. Thank you, Michael. Our next member to ask questions would be Glenn, followed by Wendy.
To echo what everyone has said thus far, thank you for a very comprehensive report back to us. My question is actually sort of one of clarification. One of the perceived benefits, and I'll put that in quotes, of e-scooters, according to the advocates today, seem to be that it increases accessibility for certain people to do shopping more easily. But is it not true from something I think was in your report or something that was said during your time that one cannot carry parcels or packages on an e-scooter?
Yes, that's correct. Under the
so therefore, would that benefit be?
Yeah, I mean, technically the Highway Traffic Act regulation says that no cargo, nothing can be carried on the e-scooter. I think it's out of concern of imbalance on the e-scooter and safety.
Yeah, and that was my point. One of the perceived benefits is something that the device could not be used for. so it's not a benefit. I'm done. Sorry.
Thank you, Glenn. I think we've just lost your audio. What I'd like to do is maybe come back to you, Glenn, if you have additional questions. I don't want you to lose your time. You were only about a minute and 15 seconds in. Oh, I see you again. Glenn, do you want to just speak? Do you have any other questions?
Not really. I just wanted to clarify that
one point
question of what a device can be used for.
Okay.
Because one of the benefits that's being sold is not a benefit that the device can be used for, if I understand correctly.
Okay. Thank you, Glenn. Thank you. Miranda, I see your hand, so I'm going to put you on the speakers list. You'll be after Wendy and before, actually Wendy's next. Go ahead, Wendy.
Thank you. And thank you, Janet, for the presentation. I really appreciated it. It was very comprehensive. My questions, I have a few questions. Two of them have to do with things that you referenced in your presentation as receiving sort of resistance or mixed feedback from the industry on. So I think you mentioned geofencing, and you said that there's been mixed feedback on that. And as well, you mentioned that there's been resistance on docking station requirements. So I wonder if you could speak a little bit more to that. And I probably have a follow-up question.
The geofencing, there are a number of companies that have confirmed that the GPS is not reliable. And in fact, it's particularly problematic if designated parking areas are based on GPS, because a user will try to return an e-scooter to the proper parking location, and the GPS signal will be incorrect, and they won't be able to return it, and then they're still penalized, and then then the customer is frustrated. So GPS generally is known to not be reliable, but there's still some companies that think it's the best thing that's available currently. There are other companies that are developing new technologies. As I mentioned, some of them are camera-based, and what they're promoting is that it's more accurate, but some other companies obviously think that that's not the best thing. So I think we would need to have some sort of verification of whether these technologies are indeed delivering what they're promising. And sorry, the other question you had was on the resistance to being docked. So one of the challenges with docked is that you would want a whole network of dock stations, and the frequency to which you could access them. The Bike Share Toronto aims to have their dock stations every 300 meters. We've heard from some companies that that is not enough frequency, that they want e-scooters to be at least within 80 meters to 100 meters frequency. So there's some, and the issue about having Lock 2, which is allowing e-scooters to be locked as bicycles are locked. As a number of stakeholders have pointed out, the bike share fleet, which is now approaching 7,000, it's over 6,800 bikes currently. If we were not to have them docked and to have them using the bike rings, that would be a lot of pressure on our bike parking system in competing with privately owned and used bicycles. So it's not really a comparable thing to suggest that rental fleets could just be parked, to bike rings like regular bicycles. So there is some. I would say there's still some issues there about the docked and docking and dockless issue.
Thanks, Janet. That's really helpful for me. I have just one more question for you too. We heard from one of the speakers today that people in Toronto are already using e-scooters, and therefore we should just go ahead and legalize it because we're going to be behind the 8 ball, I guess, if we don't do that sooner rather than later. I wanted to ask about what do we know about current use of e-scooters anyway in terms of the city of Toronto, and also my sense was that there's a possibility for people to buy scooters that go much faster than the ones that we've been talking about. And do you have a sense of how fast they can be? Are people using them that are that fast in the city of Toronto currently? Trying to get a sense of, you know, what the edges are of what's happening currently.
So I think the most important point is that if we were to enter into a pilot, there's no question we would see a much greater number of e-scooters when we're talking about the fleet. So in Paris, they have 15,000 each. There are 3 vendors, 5,000 fleet permission for each company. So 5,000 times 3 is 15,000. As I mentioned, bike share currently we're under 7,000. So the issue about who's using them currently illegally, I mean, it's difficult to say. We don't have a data collection system. As mentioned, we are stretched in terms of resources, in terms of the COVID recovery pieces. Transportation is going to be focused for sure on the rollout of active TO, cafe TO, curb TO, and other priority measures. That we would be, as I mentioned, wanting to do a baseline tracking with hospitals to see what kinds of injuries are occurring with those who are currently using e-scooters at their own risk. We anecdotally hear some sightings, predominantly that they are on sidewalks. We would need to monitor that. So in terms of retailers are supposed to be telling customers where they're legal or not legal to be used. The online, I guess the challenge with e-scooters that are purchased is that they can go as fast as 50 kilometers per hour or even faster. Typically, the e-scooters that can go faster have other aspects to them, like better suspension, and often, unfortunately, the higher cost, not always, but sometimes the higher price point provides you with greater safety aspects of the e-scooter, like, as I mentioned, suspension or dual suspension. So one of the things Toronto we're involved in is the participation along with the cities of Austin and Chicago that have had some experience with e-scooters, as well as the cities of Cambridge, Massachusetts, is participation in an industry device safety standard. There really ought to have been one. In fact, the OECD ITF report highly recommended the development of further industry specifications for device standards for consumer safety. And through that, we would like to see e-scooters that are commercially rented or used to have some improved and strengthened safety specifications. I hope this answers your question.
Janet, thank you.
Thank you.
Largely because we are running out of time. Wendy, I'm going to move on to Miranda. Miranda, you have the floor.
Yes, thank you. And thank you, Janet, again, for your presentation. It was very detailed. I really appreciate that information. So I have 2 questions that are kind of related. Going back to the issue of insurance and with insurance companies. Sometimes insurance companies, they can quickly change their policy statements. And so I'm kind of concerned for citizens in terms of proper coverage. How can we monitor it that these insurance companies are giving insurance policies that are protecting the public? And my conjunction question is, for these policies, these insurance policies, how do we regulate that low-income people can afford these e-scooters? Are there any protocols, policies that will be implemented to kind of have it as a guideline or criteria?
So, I mean, those are excellent questions. The insurance one, absolutely. I think our insurance and risk management office would provide it with that kind of expertise in evaluating whether the coverage was adequate and what the fine print says. I think that is a valid issue, and it is still a fairly new space, I would say, even with the UK trials. I think it's a valid concern, and it's something that we need to work with insurance and risk management to monitor. In terms of affordability, I would agree that at first, e-scooters seems like a more affordable option compared with bicycles, but as you look more closely at it, it's starting to be more comparative in terms of price point. It is a bigger issue to ensure that through insurance companies that there are opportunities for regular, like not through rentals, but through personally owned bikes, e-bikes, e-scooters, that there's micromobility insurance. I think we're going to see in the next several years developments in that area. I can't speak to how to make insurance more affordable, but I can speak to developments in micromobility where there's now subscription services or installment payments. So I think you're going to see more creative ways that micromobility is going to become affordable. And I know a number of councillors are also doing the same to look at ways that bicycles can be for all people.
Yes, thank you. Also, just one quick question as well. Is there a consideration for capping the premium trend that is also being reviewed for consideration?
I can't speak to that. That's probably an advocacy issue. I don't know the city. I'd have to speak with my colleagues. We don't have, that's not within our scope of ability or authority to, and insurance is a particularly tricky regulatory area, but we can certainly have those conversations with the Ontario government and FSRA, which is the Financial Services Regulatory Authority that deals with insurance regulations.
Okay. Thank you.
Thank you very much, Miranda. If I can just ask the clerk to put the screen back up for me so I can see the grid. Thanks, folks. Are there any other members with questions of staff who have not spoken as of yet? If you can just indicate, either raise your hand or perhaps unmute your microphone. Okay, seeing none. Janet, I have a quick question for you, maybe one or two. I'll try to speed it up. You've covered, and thank you for your presentation, you've covered a lot for us today. With respect to unintended consequences, because I think right before us right now is some questions about whether or not we should pilot this. And my experience with Uber and perhaps Airbnb and that type of deregulation, regulation is that when we weren't ready, it created a whole host of unintended consequences. So can you let us know what some of these unintended consequences could be if City Council went ahead and created a pilot project, just opening the door a little bit for the e-scooter rental program?
I think what we'd see is as Calgary did in the beginning, we would see headlines that ER visits would increase related to e-scooter incidences. I just want to point out that even though people might wear a helmet, what we were seeing were people were actually falling on their face, and that it's jaw surgeries, and that if you look at things like Reddit and people who are purchasing and using e-scooters frequently, they are even looking at motorcycle helmets. So I think one of the unintended consequences is that it is, at the surface, it appears very easy to use e-scooters if you don't, let's say, know how to balance on a bike, but there is balance required, and there's some skill that people might underestimate. So injuries and claims that the city would have would be one of the things we would almost guarantee in terms of anticipating. The other things we may not know, and I think Paris is trying to track this, is the modal shift away from walking and transit to e-scooters. I think some of the third-party sort of studies have shown that a good portion of trips are from walking and public transit, and that's something I think City Council, in terms of budget impacts and impacts on the city, would want to consider. I also want to mention bike share. So 3 million trips, almost 3 million trips were taken last year, and it was a COVID year. And I think when in terms of looking at the investments that the city has made, what's fascinating is that San Francisco, for instance, which is one of the first places that had e-scooters, they are now, you're hearing the leadership, the mayor and saying that they shouldn't have private operators running their systems, their bike share systems, and in fact, it should be publicly owned and overseen. And so I think Toronto might be actually ahead of the curve in that we have a really healthy bike share system. People were asking about bike share. In Seattle, they previously had 4,000 bike share bikes. The operator there, I believe it was Lime, removed the bikes and replaced them only with e-scooters. Since then, I think some bikes have been brought back, but it is only at 1/4 of the bike share fleet that was previously there. The city of Hamilton previously had bike share and had a contract. I believe it was ultimately with Uber. Uber broke or Jump that was owned by Uber, and Uber I think owns a portion of Lime. They walked away from the contract, and the city of Hamilton had to scramble to find, now it's a nonprofit that is running their bike share. I think when we hear that there are billions of e-scooter rides, I think what we don't know is what portion was from no longer having bike share. And I think that is something that we would want to keep an eye on in terms of potentially unintended consequences for other modes where the shifting isn't, there's a small portion shifted to e-scooters from ride hail or taxis, but there's also a good portion that's shifted from walking, bike share, and public transit, as well as the injuries and the liability issues.
Thank you very much, Janet. I have no further questions. If I can just get the screen back up, the grid. Thank you. Are there any other members with questions of staff? Seeing none and hearing none. Members who have comments who would like to speak, who would like to go first? Okay, Wendy, please go ahead.
I want to say that, I found a lot of the things that we heard today really surprising and hard to understand. We heard an argument being made that because this is happening already illegally, that we should just go ahead and adopt it. And I really struggle with that logic. And, it was put to us as that was the question for this committee to really think about. There are a lot of things that happen that are illegal that are not in the public's best interest, and we don't legalize them. So I don't know that that is the question that we should be asking. I think that the question we should be asking is, who are the sidewalks for? Are the sidewalks for everybody in the community to be able to participate, or is it only for some folks to use for recreational purposes? And I think this is a really fundamental question for us to think about. We as a committee, we've already heard numerous times about issues that people with disabilities have in accessing the sidewalks. And so I think that to add additional fear, to actually factor fear into whether people with disabilities now feel okay about going out onto the city streets, it just seems completely illogical to me. I think Janet, your presentation, where maybe we had some questions previously, I think you've answered all of the questions that I had, and it only really, for me, firms up the perspective that we are doing the right thing by banning e-scooters in the city of Toronto and by suggesting that we do not pilot e-scooters. I think another thing that you said that's really important is that, our context has changed also. So where you would want to have some connections to healthcare providers, where you'd want to be able to track that data, where we would want to be a little bit more particular about that, we can't do that now. And the context also exists for people with disabilities, where if you are out and about and you do get hit by an e-scooter in a pilot driven by somebody who is likely to be using it for recreational purposes, and you now have to think about going to hospital and exposing yourself to COVID. You know, I don't think it was worth it in the first place. I think that it's less worth it if that's possible now in the context that we're in. So just to say that I really appreciated your presentation, Janet. I think that for me, you have made a case even more solidly against this proceeding. So thank you.
Thank you, Wendy, for your comments. If I can get the screen back up, thank you to the clerk. Anyone else to speak? Okay. Jason, go ahead, please, Jason.
Okay. Thank you, Madam Chair. Just to echo some of Wendy's sentiments, I completely agree. Some of you may know that in my day job, I'm a Crown prosecutor, and you know, unfortunately, a lot of people in Toronto right now are using fentanyl. Does that mean because they're using it, we ought to legalize it? I mean, I'm taking it to the extreme, but that's essentially what the argument that the industry is trying to make. Well, because if people are doing it anyway, why not just regulate it? To me, that's, you know, I know I'm making an extreme example, but I don't think it's actually all that extreme. So what I'm wondering then, given that I think we're all in agreement that this committee is still opposed to legalization of e-scooters and a trial or in any form in Toronto or a pilot project, do we need or ought we have another resolution reaffirming our resolution from last February that after further study, this committee continues to recommend that City of Toronto does not lift the ban on e-scooters?
Jason, thank you. I do have a motion that is being advance circulated, so it's probably sitting in your inbox. For the members, if you can just take a look at your email, it should be there. And I think it would also, just Jason, to answer your question, it will specifically do what you're asking for. Are there any other members who would like to speak at this point?
Oh, okay, I'll look at the resolution. Yeah.
Okay, thank you. Any other members who have remarks? No? Okay, thank you. I recognize that there's a hard stop at 2 p.m., so even though you have a lot to say, you're all being very respectful of time. So thank you for your cooperation. If there are no other speakers, I will be happy to just add a few remarks myself, and also to ask the clerk to put the motion onto the screen. As mentioned earlier, it is advance circulated, so you should have a copy of it, but here it is again. So the motion is essentially to communicate to the Infrastructure and Environment Committee and to City Council when the next staff report on the e-scooter item comes up for debate that this committee does not support the use of any electric kick scooter, e-scooters in the City of Toronto, including pilot projects, and we request that a ban prohibiting their use in all public spaces remain in place without any exceptions as they continue to create a general safety hazard in the public realm for all Toronto residents. They add further barriers for the elderly and persons living with disabilities, are poorly enforced when illegally used due to inefficient enforcement resources, further encumber pre-existing inadequate infrastructure. The second part of the motion essentially is asking City Council to work with the Toronto Police Service Board, the General Manager of Transportation, as well as the Executive Director of MLS to consult with the accessibility stakeholders to develop a public campaign that allows them to effectively convey the existing bylaws in place on the prohibition of e-scooter use in all public spaces, as well as actively scale up citywide enforcement of the bylaw prohibiting e-scooters in all public spaces. That is the motion, folks. And I just want to add that I want to thank Janet and the transportation staff for all their hard work, their presentation today. I want to thank the deputants who came out because you've all given us some very rich information for us to consider. And that would also include those from who are representing the commercial interests of the e-scooter lobby. I think that the process around public engagement is important, and this forum is very important to enable all of that information to come to the committee members for review and consideration.
The piece of this debate and this matter that really hits home for me is actually a comment that was raised, and a very salient comment that was raised by David Lepofsky at the beginning of his remarks. He talked about creating additional barriers and obstacles in the city knowingly. I think that at one point in time, there was not a lot of information. Now that the information is before us, and of course there will be further studies and further review, but I think that we have enough to work with. It is not within this committee's, I would say, sort of role to tell City Council or to give advice to the Mayor and Council that we should put more obstacles in place so it makes life more difficult for people living with disabilities. That is entirely not what we're supposed to do. Our job is to give advice to Council and to provide advice to them on how we can make the city more accessible. How do we ensure that our decisions and around policies that are being developed by City Council actually make this city more accessible, freer from any obstacle and barriers. So it is without any, we actually have our hands tied as far as I'm concerned, and I think that we would be doing our job by letting the City Council members know, and the Mayor and all the members of Toronto Public Service, is that if they go ahead with a pilot project, they're about to breach the spirit of the AODA code, not to mention the fact that we're going to make that job even more difficult. And that is essentially why I think, to me, at the core of this debate is, are we going to be providing good advice to Council on creating a barrier-free, accessible city, and by even piloting a project with the intended consequences and even the unintended consequences named by Janet, the risk is simply too high. If anyone has actually watched how City Council and the city staff have been monitoring and trying to regulate Airbnb, just by way of example, you know that we don't have enough enforcement. We are hearing from residents across the city that there are those who are not wearing masks and they're in breach of the public health bylaws. And when you call for assistance through 311, we tell them we don't have enough individuals to go out to enforce. So we don't have the ability to enforce a bylaw that I think is going to be inherently unenforceable. So why would we knowingly walk into that quagmire? So that brings me to the end of my remarks. I want to thank everybody, including city staff once again, for all their hard work. Sorry, I'm a little bit winded, largely because I have asthma. Speaking through a mask is very difficult. Any questions of the mover, folks? No, seeing none. Jason, just because I can't see your hand, do you have a question of the mover? Okay, I'm going to take that as a no. Are there any other final call for speakers? Okay, seeing none, then we're ready to vote. Is that correct? Okay, so clerk said we're ready to vote. All those in favor of the motion? Actually, I'm going to ask for recorded vote, if that's okay. Okay, so if you can just indicate your support by raising your hand, and Carol will, I'll do it. You know what? Sorry, folks. Jennifer, can you just take a recorded vote on this?
Yes.
Thank you very much.
Recorded vote on Councillor Wontam's motion to amend. Mirand Frey.
If you can just say in favor or opposed. Sorry, Miranda, you're muted. In favor.
In
thank
favor. Glenn Hart.
In favor.
Michael McNeely.
In favor.
Great, thank you. Liv Mendelson.
In favor.
Jason Mitrea.
In favor.
Wendy Poch.
In favor.
Bhuvani Sivaganana Sudaran.
In favor.
Howard Wax.
In favor.
And the chair, Councillor Wontam.
In favor.
Great, the motion carried unanimously. Thank you, everyone.
Okay. Thank you very much to the clerks, and thank you to all of the members today. I believe this brings us to the end of the meeting. Okay. Okay, yes.
Madam Chair,
Yes, Jason, go ahead.
may I ask one last follow-up question?
Who's your question going to?
It's going to you, Madam Chair.
Okay. Yes, go ahead, please.
So I was hoping that Mayor Tory would have joined us today, but since he hasn't, will he be made aware of this vote, and will he be given access to the YouTube link so that he may be able to watch these proceedings?
Yes, I can take that as a request to circulate the YouTube link as well as a copy of the motion to all the members of council. I recognize how important this debate is to this committee, and I know that it was important for some of the speakers who are hoping to see councillors here. And I think we should also thank Councillor Fletcher, who joined us for part of the meeting.
Yeah, thank you.
Okay, thank you.
Thank you very much.
Thank you. Now, before everybody dashes off, there's one final bit of business. We need to move this motion, and it is to excuse the absence of Michelle Petridis from the February 25th, 2021 Toronto Accessibility Advisory Committee meeting. All those in favor of that motion? Any opposed? That carries. Thank you very much, everyone. Just under 2 o'clock. You've been wonderful. This has been a full day, and I'll look forward to seeing you at our next discussion. Okay. Take care. Please be safe.